Good afternoon, and welcome to the Committee on General Welfare. At this time, we ask you please place your phones on vibrate or silent. Thank you for your cooperation. Chair, we are ready to begin.
Good afternoon, everyone. My name is Diana Ayala, and I am the Deputy Speaker of the New York City Council and Chair of the General Welfare Committee. I'd like to begin by thanking everyone for joining us this afternoon. Today, our committee is holding a hearing on 11 bills, Intro 92, which I have sponsored, along with Intro 522, sponsored by Councilmember Bottcher, Intros 513 and 132, sponsored by Councilmember Ung, Intro 421, sponsored by Councilmember Riley, Intro 229, sponsored by Councilmember Gabang, Intros 431 and 124, sponsored by Councilmember Salamanca, Intro 276, sponsored by Councilmember Osei, Intro 190, sponsored by Public Advocate Williams, Intro 108, sponsored by Councilmember Holden. Since many of the sponsors of these pieces of legislation are here to speak about their respective bills, I will not get into specific details of each. Instead, I want to uplift the fact that we are here to discuss these bills because our homeless shelter system in New York City is broken. We need to find ways to make the system run as efficiently and effectively as possible for some of our most marginalized populations. And what we have seen, especially in the last few months, is that there is a lot of work yet to be done. These bills include solutions for how we can close gaps in the system at large, including my bill, Intro 92, which would create an advisory board for accessibility of shelters. We have heard anecdotally of clients in the DHS shelter system who have a disability being placed in shelters where there is no working elevator and they have no way of getting to their bed. This is unacceptable. And just last week, we saw what occurred at the Bedford Atlantic Armory between a recent migrant who is an asylum seeker and a DHS shelter police officer. What are we going to do to improve conditions at our shelters, including client safety? The legislation that we are hearing today includes several bills that require trainings so that the city can improve client-staff relationships and effectively de-escalate situations that call for a trauma-informed approach. Over the last few weeks and at our last committee hearing, we also heard about so many of the issues of with shelter intake, especially for families with children at PATH. Today, we are hearing several bills that address how we can ensure a smoother intake process, including empowering community-based nonprofit organizations to conduct intake. The bills we are hearing today also include bills that will call for increased mental health services among shelter clients and reduce barriers to accessing permanent housing by making City FEP's rental assistance vouchers more usable in practice. If we truly want to reduce the challenges of the city's overburdened shelter system, we need to have nuanced conversations about how the system operates on the front end and on the back end. Today, in hearing these bills, we are seeking to have these nuanced conversations. I want to thank the administration, the advocates, legal service providers, volunteers, and any individuals with lived experience who have taken the time to join us. At this time, I'd like to acknowledge my colleagues who are already here today, Council Members Riley, Caban, Lee, Osei, Bottcher. Did I miss anyone? Yeah, I think I have everyone. And I would also like to thank my committee staff who worked to prepare this hearing: Aminta Kilawan, Senior Counsel; David Romero, Counsel; Christy Dwyer, Senior Legislative Policy Analyst; Julia Haramis, Senior Finance Analyst; Rose Martinez, Assistant Deputy Director; Nicholas Montalbano, Senior Data Scientist; and my staff, Elsie Encarnacion, Deputy Chief of Staff. I will now turn it over to the sponsors of the bills that we are hearing today to give brief remarks. We will start with Councilmember Bottcher.
Thank you, Deputy Speaker Ayala. I'm really grateful for this hearing today and for your co-sponsorship of our bill and for your leadership on this and so many other issues for many years. I also want to thank my prime co-sponsors, Chi Osei and Carlina Rivera, and the 35 council members who have signed on to co-sponsor Intro 522. We are here on behalf of the over 10,500 families, including 17,000 children who slept in New York City shelters last night. We're here because families deserve mental health care to. And I'm so excited that our legislation that will help ensure that they get that care, Intro 522, is getting a hearing today. Intro 522 would require mental health professionals to be made available in each family shelter and for the Department of Homeless Services to provide on-site mental health services. The bill would require DHS to maintain a ratio of at least one full-time mental health professional for up to 50 families with children, and it would require DHS to annually report on these services to the mayor and the speaker and publicly. I say our bill because this bill is the result of a collaborative effort between the City Council and direct service providers. Women in Need, WIN, and their CEO, Christine Quinn, were instrumental in the creation of this bill. I actually attended a panel discussion earlier in the year where the lack of mental health services in shelters was identified as a major issue facing families. And a lot of times at these panel discussions, there's lots of notes taken, but not necessarily a lot of follow-up. But in the weeks and months that followed, we developed this legislation to address this critical issue. I talk a lot about why this issue is personal to me. I am someone who got mental health care. When I was in high school, I spent a month in a mental health hospital upstate after a series of suicide attempts, and that health care is why I'm here today. But that kind of mental health care is not available to most people. It's just not, particularly if you're a person of color in this country, a person living near or below the poverty line, and especially if you're a person living in shelter. And that's wrong, and that's why we're here today. I really look forward to this hearing, and I want to thank the Adams administration folks here for devoting your lives to this important cause and for all you do and for working with us on this legislation. And thank you to Deputy Speaker Ayala and all my colleagues.
Thank you, Councilmember. We will now hear from Councilmember Caban.
Thank you, Chair, and thank you for the committee staff and for all the folks who are here. I am so excited that today's agenda includes Intro 229, which I've introduced in partnership with Chair Ayala. When the Department of Homeless Services, DHS, deems a New Yorker eligible for a housing voucher to rent an apartment, they receive a so-called shopping letter that identifies the maximum rent a recipient can pay based on household size and income level, and unfortunately, this maximum rent often includes utility fees, and it's forcing many voucher recipients to stay in our shelter system for much longer than they should. And this bill will eliminate the utility allowance from the equation, move people from shelter housing into permanent housing more quickly, and get us closer to a city where comfortable, reliable housing is treated as a basic human right, not a wealth acquisition scheme for developers and landlords. And so thank you to advocates that have worked with our office on this bill, and to all of you that have taken the time to give us feedback today, and I will pass it back to you, Chair.
Thank you, Councilmember. We will now hear from Councilmember Osei.
Thank you, Chair and Deputy Speaker. Homelessness is a trauma. I think all of us know that in this room, and I think that's why we're all here doing the work that we are doing with these various pieces of legislation. According to the Substance Abuse and Mental Health Services Administration, people experiencing homelessness have to deal with a multitude of challenges, such as loss of home, instability, and adjusting to shelter life. On top of this, individuals and families experiencing homelessness also experience other forms of trauma, such as domestic violence, child abuse, sexual abuse, or growing up in poverty in and of itself. When people are experiencing trauma, they need to be met with care, compassion, and understanding, especially from the people who are supposed to help them get back on their feet. Under Intro 276, my bill that we're having a hearing on here today, the Department of Homeless Services will be required to provide their staff with trainings on techniques to improve professionalism, increase cultural sensitivity, de-escalate conflict, and use trauma-informed theory. With homelessness on the rise because of an affordable housing crisis and an influx of asylees staying in our shelter system, we need to ensure that all individuals and families who are experiencing a form of homelessness in our city are addressed with care, compassion, and understanding. I've said it before, and I'll say it again. We often talk about homelessness and mental illness as a homeless problem or a mental illness problem, but I see it as a problem of New York City government, a failure of New York City government. And that's why we are all taking the steps here today with these various pieces of legislation. Now more than ever, we need to pass my bill, like Intro 26, 276, to ensure that we get individuals and families the resources and services they need while treating them with dignity and respect. Thank you, Chair.
Thank you. We will now hear from Councilmember Riley.
Thank you, Chair Ayala. Adequate and encompassing data reporting is key to identifying areas of opportunity within our city infrastructure. Intro 421 will require the Department of Homeless Services to produce regular reporting on families with children in homeless shelters, giving more insight to identify the needs of New York families. Not only does it provide further data transparency in our shelter system, but the extent of these reports will provide a further look into expanding our resources and services to uplift these families. Having access to the total numbers of families with children entering the shelter system, their average length of stay, and the total number of families leaving the shelter to permanent housing can pinpoint the individualized needs of families placed in the shelters. This legislation would monitor the school enrollment and attendance for children living in shelters, empowering our New York City schools to provide a supportive learning experience and ensure that these students have the tools that they need to succeed in spite of challenges their families may be facing. As a city, we must protect New York families, preventing them from entering the shelter system, but also creating a sustainable plan that helps them get out. I encourage the support of Intro 421, which would add an adequately expanded preventive and restorative services such as long-term family planning, financial building, and personal professional development. Importantly, to effectively address the crisis of homelessness in New York City, we must continue to understand the ins and outs of the shelter system, especially when it pertains to our youth who are the future of our communities. This legislation seeks to provide a foundation to mobilize the equity, accessibility, and efficiency of the resources through the Department of Homeless Services. And I would like to thank Chair Ayala for signing on to this bill, Councilmember Lewis, Councilmember Nurse, Councilmember Christian, Abreu, Velasquez, and Williams. And I encourage the rest of my colleagues to sign on as well. Thank you.
Thank you. I will now turn it over to Committee Counsel David Romero to administer the oath to witnesses from the administration.
We are now going to call on members of the administration. Marika Scott McFadden, Deputy Commissioner for Intergovernmental and Legislative Affairs, Department of Social Services, and Molly Park, First Deputy Commissioner, Department of Homeless Services. Will you please raise your right hand? Do you affirm to tell the truth, the whole truth, and nothing but the truth before this committee, and to respond honestly to council member questions?
I do.
Thank you. You may begin when ready.
Good morning. I want to thank the General Welfare Committee and Deputy Speaker Ayala for holding today's hearing and the opportunity to testify. My name is Marika Scott McFadden, and I'm the Deputy Commissioner for Intergovernmental and Legislative Affairs at the Department of Social Services, and I'm joined by my colleague, Molly Park, First Deputy Commissioner at the Department of Homeless Services. Today's hearing will focus on several bills impacting DSS, the Human Resource Administration, HRA, and Department of Homeless Services, DSS. We look forward to discussing these proposals today and better understanding their intent. Before we start, I want to emphasize that it is our priority to ensure clients have access to the services they need. However, many of these proposals are duplicative. We ask that this committee seriously consider the cost, programmatic, and staffing impacts these bills would have on our system as we discuss them today, and to keep in mind the many reforms we've implemented to better serve New Yorkers in need. Moreover, several of these bills are still being reviewed by our legal team. With that in mind, we look forward to today's conversation. Intro 522 will require mental health professionals to be made available in families with children shelter for DHS to report on the provision of such services. While the intent seems helpful, we have several concerns about this proposal. First, implementing the bill would be extremely costly as it requires hiring a significant number of mental health professionals. Additionally, given recent national shortages of mental health professionals, it could be difficult to comply with the bill's requirements at any price point. In addition, DHS already provides social work professionals in family shelters as part of the shelter model budget. These professionals conduct biosocial, psychosocial evaluations and make referrals to other professionals when appropriate. Most importantly, given that families will be transitioning from shelter, it would also be more effective to refer them to services in the community. Lastly, the reporting requirements would be burdensome to the administration given the absence of resources included in the legislation. We look forward to speaking with the sponsor to further discuss these proposals. Introductions 132 and 513 would represent tremendous challenges for the agency. Intro 132 would require DHS to establish additional intake centers for families with children in boroughs without existing intake centers. As last stated by our commissioner to this committee, this proposal would have significant costs to the city, an important factor that this bill fails to thoroughly consider. DHS opened the Prevention Assistance and Temporary Housing PATH intake facility after revamping its intake and eligibility protocol to improve and expedite the processing of applications and provision of conditional placements for families into temporary emergency housing. Our centralized shelter intake was specifically designed and built for families with children and allows for consistent screening of critical factors and assessments for conditions related to medical needs, mental health, substance use, adult and child protective services, and domestic violence, a significant issue in the families with children population. Moreover, centralization fosters the continuity of services by utilizing interagency linkages, such as with the Department of Education, Administration of Children's Services, and others. Decentralizing the intake process loses the economies of scales built over time, dilutes the safeguards in place for vulnerable families, and will slow the process of placing families in shelter. Related to shelter intake, Intro 513 would require DHS to report to the feasibility of partnering with community-based nonprofit organizations to accept and process applications for shelter intake for families with children. We have several concerns about the proposals in this bill. As noted above, there are significant service benefits with a consolidated intake process. In addition, devolving such a critical and meticulous process to community organizations could result in families receiving inconsistent services. Lastly, there could be client privacy and quality of service concerns, factors that would take substantial resources and funding to oversee and execute by DHS. Intro 92 would require the DHS to create an accessibility advisory board on issues related to accessibility in city shelters. Our agency has concerns regarding this proposal, as accessibility is currently governed by the Butler Consent Decree, and DHS is following this process. We look forward to discussing with the sponsor to understand the full intent of this bill. Intro 190 would require DHS to produce a homeless Bill of Rights to inform New Yorkers experiencing homelessness about their rights and services available to them. DHS already ensures our clients experiencing homelessness are aware of services available to them and their rights. and we work to communicate this at several touch points across our system. We are open to the bill's proposals, and we look forward to working with the sponsor to explore implementation. Introductions 431 and 276 would require DHS to conduct customer service training and report on this training. The requirements in these two bills are duplicative as they present similar training topics. DHS conducts a series of fundamental courses focused on client engagement to ensure our staff and providers provide New Yorkers with the utmost care, compassion, and professionalism. We look forward to working with the sponsors to further understand these proposals. Introductions 421 and 108 would introduce new reporting requirements for DSS, DHS. As previously mentioned to the Council, we value the importance of transparency and accountability that our agency reporting brings to our discussions with the Council and public. However, we want to emphasize the significant costs and resources it takes to produce reports, which is why we want to stress the importance of streamlining reporting requirements to avoid duplication and wasted resources. With that said, we have significant concerns about both reporting bills. Introduction 421 would require an onerous amount of reporting regarding our families with children shelter population. First, the reporting requirement duplicates some of the reporting requirements of the revamped Local Law 337 of 2011 as amended by Local Law 79 of 2022. Moreover, some of the level and granularity of data being requested by this bill does not exist, so it would create administrative burden on the agency. The bill also requires data coordination with other city agencies such as Department of Education and Administration of Children's Services, which raises privacy concerns about confidential information, particularly for minors, and the requirement of parental consent. The monthly reporting requirements are unrealistic given the concerns just mentioned. Introduction 108 requires reporting that would be duplicative of existing metrics provided by the agency and an administrative burden to carry out in the manner proposed by the bill. We look forward to further understanding the full intent of this bill with the sponsor. Introduction 124 is in relation to designating housing specialists in HRA and DHS shelters. DSS, HRA, DHS staff, and providers work each day to transition and place New Yorkers in need into permanent housing, and this critical work is done through the many caseworkers and housing staff embedded throughout a HRA and DHS shelter who visit the sites regularly. All DHS shelters are already funded to provide housing specialists on site as part of the model budget. Given this, we find that the requirement of this bill would be duplicative of our current work, and cost considerations must be taken into account for any additional requirements placed on the agency. We look forward to further understanding the bill's intent. Introduction 229 is in relation to monthly rental assistance payments for households with rental assistance vouchers. We believe that the Council intends to protect tenants, but we have significant concerns about the drafting of this bill, as we believe it could actually be harmful to tenants for several reasons. City for HEPS, like Section 8, is based on the fair market rent, which is the maximum the program can pay if all utilities are covered in the rent. If the agency is forced to pay the landlords the full rent, regardless of what utilities they offer, and in most New York City rental units, the tenant is responsible for paying utilities, then we will not be able to subsidize the cost of utilities for tenants. When DSS has finished building and modifications to our subsidy payment system, we intend to ensure that the utility allowance is provided to the tenant, each as part of either as part of the public assistance benefit or as a reduction of their rent contribution. We would not be able to pass the utility allowance to the tenants who pay for their own utilities because it would have been provided to the landlord. Additionally, we are finally at a place where all city subsidies are mostly aligned with each other and landlords cannot discriminate between voucher holders. If City perhaps does not deduct a utility allowance from the landlord, EHV and Section 8 voucher holders will have a more difficult time securing housing. We believe we share the same goal and look forward to discussing further with the council. We appreciate the opportunity to provide feedback on these proposals, and we look forward to working with the council to serve New Yorkers in need. Thank you, and I look forward to any questions you might have today.
I want to recognize that we've been joined by Council Members Russer, Stevens, Williams, and Hudson, and we have also been joined by Public Advocate Jamani Williams, who I believe is going to give a statement.
Thank you so much, Madam Chair. As I mentioned, my name is Jamani Williams, Public Advocate for the City of New York. I want to thank the Chair and the members of the Committee on General Welfare for holding this hearing. First, of course, I always want to make sure we mention in the issues of housing and homelessness, the #1 need here is actual housing that people can afford. My office is going to continue to work on a plan. I started when I was running across the state to help build and preserve 1 million units where people are paying no more than 30% of their rent and income. But with that said, in the winter of 2020, there were nearly 80,000 people unhoused in New York City, the highest number in the city's history. In June 2022, there were over 50,000 people, including over a third of children, sleeping each night in New York's municipal homeless shelter. The city's current efforts to combat homelessness are clearly not working. The system as it stands now is at best inefficient and at worst in many places inhumane. We know the solution to homelessness is not more shelters, it is more permanent affordable housing. For adults, young people, and families experiencing homelessness, the path to housing assistance is filled with red tape, confusing and sometimes conflicting requirements, stress, and suffering. For people with disabilities, mental health, or other medical needs, and people whose first language is not English, the process is especially difficult. While some experiencing homelessness may be lucky enough to have an advocate or social worker to guide them through the shelter system, most are expected to navigate their process on their own. For these reasons, I have introduced Intro 0190, which would require the Department of Homeless Services to produce a homeless bill of rights. This document, which DHS would be required to make available on their website and to shelters and social service offices for distribution to people experiencing homelessness, would inform people experiencing homelessness about their rights and services available to them. This includes, but is not limited to, right to shelter, access to legal services, the right to request an interpreter and translation services, how to file a complaint, educational options for children, the right to vote, housing and financial assistance, protections against discrimination, the right to request accommodations for disability. In addition, the document would include the right of peoples in shelters, including the right to meet privately with advocates and legal representatives, be placed in a room with a person who identifies as the same gender, a private room with a lock for families experiencing homelessness, a secure locker for single adults experiencing homelessness, access to bathrooms, access to washing machines and dryers or money for laundry, access to space and equipment to bathe and change babies and small children, meals and accommodations for dietary needs and restrictions. The legislation is vital as it brings together already existing rights under one section in the city's administrative code and it codifies existing case law. The congregation and posting of rights enable people experiencing homelessness and advocates to easily access and be informed of their rights. I want to thank my colleagues in the City Council who have co-sponsored this critical piece of legislation. I look forward to working with the Council and the Committee on General Welfare to end homelessness and achieve true housing equity in our city. And I want to thank you for your comments. I look forward to working with you on the bill. Good to see you again.
Thank you. So we're going to be hearing, I think the fairest way to do this is we want to be hearing from the council members who have introduced legislation today, but considering how we have a little special guest here, I'm not sure if the public advocate had some questions that he wanted to ask. And you're only getting this privilege because of the baby.
I need to bring her more often. Thank you. Thank you. Appreciate it. Good to see you.
Good to see you.
So I heard that the interest in working with me on the bill. I also heard mention that you already do some of the things. And so, as I mentioned, our objective here is not to create new laws. It's to try to put everything in one place, because what we found is people don't always understand their rights, even though they are there, and even though parts of them may be informed. So is it something that you think can be worked on?
Yes, as I stated in our testimony, DSS performs many of the tasks that you've outlined, and we focus on the touch points throughout the system, actually making sure that our clients are aware of their rights, and so we welcome further discussion.
All right. I always try to be clear, because sometimes further discussion is nebulous. So do you think we can come together and get a Bill of Rights that's like a one thing that we can be giving to folks who are unfortunately experiencing homelessness?
I think it's fair that even though it may be a nebulous statement, we really want to work with you on this because we feel that we are already doing it.
Okay. That sounds kind of no-ish. But I guess we will, I feel like there is things being done, but they're not happening all in one place, and we're trying to make it so that people can have access to this stuff in one place without searching around. I will pause now, and hopefully we will continue the conversation so we can, I guess we can speak the language that we're both trying to say at this moment in time and be on the same page.
Yes.
Thank you.
Thank you. I have just a few questions, and then I'm going to turn it over to the chair, to the council members. But there were some things that were stated at the in your briefing. So regarding Intro 92, understanding that the Butler decree, consent decree, really dictates, right, the way that we look at the design, right, of our shelter system in a way that meets the needs of individuals with disabilities. The bill kind of came from conversations with primarily individuals living at Ward's Island, and complaints of individuals being placed in shelter settings where elevators were necessary, where elevators sometimes were not functional. Individuals that maybe have power operated wheelchairs and had no access to outlets because there were a minimal number of outlets in the facility. Individuals who had difficulty getting in and out of the bathroom because the way that the door opens is very important, if you're a person using a wheelchair. This came up a couple of years ago. We had a discussion under then Councilmember Levin. And, we, obviously this is kind of a follow-up to that, but I wanted to hear, because I'm not at the shelter, right? Like, if an individual that is a wheelchair user is coming in and is placed on a third floor, that to me is not a reasonable accommodation.
Thank you for your question. I want to just affirm that the Butler consent decree is a multi-year statement, and therefore it does speak to ADA accessibility, and we are working within the confines of that decree. That being said, I'll allow my colleague to speak to some of the specifics that you just talked about.
Thank you, and thank you to the council for having us here today. I'm Molly Park. I'm the first deputy commissioner. I can't obviously speak to the individual cases, but in general, when an individual or family comes into intake, there is an assessment process about whether or not they have specific physical needs that would dictate their shelter placement. If something is what we call reasonable and apparent, so somebody in a wheelchair, there's no paperwork necessary, they should absolutely be assigned to a site that is accessible. If they have a need that is not reasonable and apparent, that we can't just witness, there is a formal reasonable accommodation process. People's circumstances can certainly change after they come in through intake. They can file for a reasonable accommodation process at any point in time. There are posters about reasonable accommodation and how to file a reasonable accommodation in all of the shelters, and it's something that caseworkers should be working with clients if they need help doing that. Clients can request the help or not request the help. It is up to them whether or not they want to complete the HIPAA documentation. That's certainly not to say that there aren't cases where mistakes have been made or that a client has, their circumstances have changed and they haven't filed a reasonable accommodation. We are always happy to work with individual clients to make sure that we get them to the placement that we need to. We have within our agency have hired in the last 18 months or so disability affairs coordinators, so whose job it is to work specifically with clients and make sure that they are getting access to the shelter placements that they need. And I think the last thing that I would say is that we also have a consultant contract where we have construction experts in accessibility who are out and looking at all of our new shelters to make sure that as we are going forward that we are adding a significant volume of accessible capacity.
But would you be able to tell me how many electrical outlets exist at our Wards Island facility that would allow a person with a wheelchair that needs to be charged, or a person who requires the use of a sleep apnea machine to breathe at night, to be able to connect to that outlet?
So I don't have that data with us. It's something we can follow up on. But again, if that was something that wasn't available, that is absolutely the kind of situation where a client could file a reasonable accommodation and where we would make other arrangements.
Do you know what the length of time is from the time that a person files to the point where a resolution is determined?
It depends a little bit on how complicated the situation is, how much paperwork is provided by the medical providers. It's generally fairly short. There were, I think, some delays during COVID, but we are doing it in real time at this point.
My sense, and I've gone to quite a few shelter settings, is that they're not retrofitted, and they're retrofitted for the general, population. I don't remember, and I may be wrong. So this is not a statement, but rather a question. Seeing any type of setting where that level of accommodation is evident. So that I'm an individual, doing intake at Bellevue, and I'm sending someone towards that has a specific need. I know that need can be met there, as opposed to sending them to, someplace else, maybe in Brooklyn, the Brooklyn Armory, right?
So there absolutely are facilities in our system that cannot accommodate people with disabilities. That is something that we are addressing by making sure that as we add new capacity that it is accessible. It's very much a priority for us, and closing sites that don't live up to our standards. So there is a site on Wards Island, for example, that will be closing because it doesn't meet those standards. So so that is a process, right? Because we are at a point right now where not all of the capacity in the system is accessible. It's a process with our placement team, where it's work between intake and the placement team to ensure that people are placed in shelter assignments that do meet their needs, because it isn't everywhere. Again, if needs change between intake and exiting the shelter, or it looks like a placement is going to work and then it turns out it doesn't, that is something that we can change going forward.
Okay. Does that include the older adult population? Because as we're seeing more and more senior citizens enter the shelter system, they obviously come with very unique needs.
So we have some shelters that are specific for, that have age restrictions on them that are specifically for older adults. Those generally have particular physical accommodations there, but there are older adults that by either sort of preference or other needs, they needed to be in a particular geography, something like that, are not in shelters that are dedicated for that population, but again, we will look to meet physical needs.
And does the Butler decree require that there are accommodations for the visually impaired as well? Is information available through via Braille?
I believe so, but I'm going to have the legal team circle back with you because I don't want to give incorrect information.
Okay, I appreciate that. But I think that you kind of get the sense of where we were heading with this. Again, a lot of this information was received from individuals that are currently living in the shelter system who have had great difficulty accessing, things as simple as an electrical outlet. And we want to make sure that obviously, there's a person that is equipped to identify and that can, is assessing, right, the accessibility of all of the sites that we're currently using, so that we're making sure that people are living as dignified as possible, and not having to struggle to have access to a breathing machine at night. There was a couple of more questions regarding the Councilmember Botcha's bill, which I'll let him speak on. There was, I think that what was said was that the implementation of this bill would be extremely costly, and it would require hiring a significant number of mental health professionals, and that given that families will be transitioning from the shelter into communities, that it would be easier to refer them to communities. Is that something that's happening today? Is there, what assurance can you give this body that that those connections are being made? Because in fact, what we're hearing is that families oftentimes are receiving a certain level of support while they're in shelter, and then when they're exiting shelter, they're kind of stripped away of that, right? And they're kind of left a little bit vulnerable. So I just wonder whose responsibility it is to make the connection, and who's making the referral. Is it do we have social workers that are sitting with folks and determining that this is a specific need?
So at our Families with Children shelters, we do have social workers that make those assessments at the point of contact, and they're able to make those referrals into the community, as we have testified to today. And so the opportunity is to keep those connections open as they move into shelter, permanent shelter outside of our facilities.
I think that my concern is that as an individual, it's very difficult to access mental health care because we don't, it's not readily available in our communities, and where there is opportunity, because it's limited, the wait time is, can be pretty lengthy, sometimes upwards of 6-7 months before you're able to see someone. So my concern is that if there's no quantifiable data that really that says, hey, these are the amount of people that have been referred out successfully, then there's no reason for us to assume that is a given. Yeah, are they able to? Are they in a position where they would be where the workers would be able to make that referral? Probably, but are they making it is a different it's a different conversation.
I think that our concerns are based on our goal being permanency and moving out of shelter into permanent housing and into the community, and making sure that these resources are available within the community. We understand that within the shelter there was a goal of stability, and so we work with them to make sure that we'll work with our clients to make sure that is what's happening within the shelter. Our challenges and concerns around the proposal is around making sure that we don't concentrate healthcare within the shelter system.
I think I disagree, because I think that that we should be dealing with families on a holistic, from a holistic lens, and that if we're not addressing the mental health needs, and it jeopardizes their ability, to successfully live independently outside of the confines of the shelter system. And I'm not saying that it's impossible, but I'm saying it would make life easier. And I know that cost is an issue. That's not something that I'm not taking into consideration, and I think that my colleagues take that very seriously. But at what point, I don't think that we should there's such a value, right, to providing this level of service that it's imperative that we look at different ways to identify funding streams to support it. Now, regarding intros 132 and 513, okay, regarding 132, you said that the 132 would require DHS to establish additional intake centers for families without existing intake centers. It would be, again, is a cost issue, which we did consider, by the way, but I believe that, when I went into shelter, I was in shelter in 1991. And I remember coming to PATH here on Catherine Street, which was, I'm not sure if you still use that site, but it used to be an intake center. And every borough had an intake center for a matter of convenience. It's just, it's borderline inhumane, right? To make families that are already struggling, we're asking them to show up to the intake center with their children, with their stuff, when they're already obviously going through a very traumatic experience, very challenging, time, and now they have to travel and commute outside of their borough to be able to access services. So I think that it makes sense to rethink that model and figure out ways to kind of re-implement it in a way that speaks to the needs of each community.
Yes, Molly.
Thank you. I think our concerns with these bills go well beyond cost. I think we have a lot of services that are co-located at PATH, right? So when a family comes in, there's a domestic violence screening, there's medical screening, there's DOE is on site, ACS is on site. We are able to bring all of these resources together and really do a holistic assessment and do effective diversion wherever possible, right? HRA is also on site, able to provide one-shot deals, other kinds of benefits that might help a family stay out of the shelter system. Because we are all in one place, we can provide this very robust set of co-located services where we can look at those holistic needs. So I think that provides better services to families. And then the other piece of it, and this is particularly true right now when we have a very high volume of people coming in, the team that is managing the placements is coordinating with one intake site. So they know very well who needs a placement and where the vacancies are. That expedites the process of getting a family to placement. If what you had is the intake team managing multiple different sites, it becomes a significantly more complicated process, and the timeline that it takes to get from through the intake process actually into a placement is going to be longer. So that's another form of challenge and trauma for the families. So we actually think that by, understand the challenges around travel, but we really think that by providing a single co-located intake facility, that we are providing the best possible service that we can.
Okay. All right, I'm going to just pass it over to Councilmember Botcher.
Hi. One concern that you've raised about the bill that would require mental health services to be provided within the shelters is that currently families receive mental health services externally, that they are referred externally to community-based health care. Can you tell us how many families were referred to health services externally last year, and of those, how many of those appointments were actually kept?
Thank you for the question. Unfortunately, we don't have that level of data with us today, and we'd love to connect with you and the rest of the council with the response.
Thanks. Because according to the Office of Community Mental Health, 66.7% of families have been screened for behavioral health needs, yet only 0.4% of families have been able to attend an appointment from January to March of this year, and only 2.3% were able to attend an appointment from April to June of this year. Can you understand why those numbers would be alarming to us and to the service providers who've indicated that the current system isn't working for families?
So thank you again for your question. I will begin a bit by just reiterating the points that we've made in terms of wanting to make sure that we don't concentrate healthcare into the shelter system, and how important it is that we work through permanency and really working through the process and making sure that that process includes mental health care after in the community. And I'd like to allow my colleague to speak if she has anything to add.
Sure, thank you. I mean, we are absolutely committed to mental health services for children. I think in the housing blueprint that was released a couple months ago, one of the initiatives in there was to expand telehealth, telemental health services for children, which we think is a relatively quick way to access services. I think we acknowledge the challenge that you all have raised, is that there is an absolute shortage of mental health professionals in the city of New York and the country, frankly. So the existing social workers in the shelter, combined with this expansion of telemental health services, we think are a way to quickly meet people's needs while they are in shelter, but really the hope is that the in-shelter piece of it is relatively short. Right now we're talking over a year, but even over a year in this scheme of a child's life and their ongoing healthcare needs is not that long, right? And if there is then a gap of as the chair mentioned, 6 to 9 months to access services once you leave shelter, that's a problem, right? So being able to leverage the resources that exist within shelter to meet a child's immediate needs, but while also working on that referral, so that when that family is in permanent housing, that there is an ongoing pathway. We think that is the right way to approach it. Whether or not that system works exactly the way it should, I think, is an open question. And as we noted in the testimony, we're more than happy to work with you on the goals here. We just, I think, have some real questions about whether or not locating it all in shelter is the right approach.
Thank you, because what we're hearing is that while that might sound great on paper, in reality, the connections aren't being met. And many connections may be happening, but from some of the largest providers, like WIN, for example, the largest provider of family shelter, they're reporting that the connections aren't being made. You had referenced a shortage of mental health providers as a barrier to providing this level of care, and that's undoubtedly a big problem. What is the Department of Homeland Services doing, and what is the Adams administration doing to help increase the number of mental health care providers, the number of people entering the field? Last year, the Adams administration, earlier this year, announced something great, which is a $2 million scholarship with CUNY for video game development, which I think is great. What kind of efforts are happening to increase mental health care workers?
I think that, thank you obviously for that question. It's really important that we really drill down into healthcare and mental health care as well. And I'm sure the administration will take into consideration everything that we talk about here today in this hearing. And I think it is a part of what we do every day, wanting to be supportive of our clients, their mental health, and bringing them into permanent shelter. And so this hearing will go a long way to inform us in our practices as well as the administration.
Thank you.
Thank you.
Thank you. Councilmember Caban is next, but we're gonna kind of skip you real quick and let Councilmember Lee, because we have a vote next door real quick. So she'll go and then you. Oh, you do too? Okay. So then, yeah, so what we'll do is that, she only has a question, but you have a bill. Do you have a bill too, Linda? I'm sorry.
Sorry, hi. Really quick question regarding Councilmember Botcher's bill. So is there a way where, because I used to, I started and ran an outpatient mental health clinic in Article 31, and is there a way for DHS to work with the state and the city DOHMH to do almost like sort of MOUs as a solution? Because I know obviously the workforce is a huge issue in the mental health sector right now. So would there be a way to potentially partner with some of the outpatient nonprofit organizations out there that are doing the work on the ground as an MOU, and also connecting them? So the way it works also is that if an inpatient facility, what they do is before they check out the client, they'll connect them to an outpatient facility and then send them on their way and make sure that the continuation of care is there. So if there's a family, let's just say in a shelter setting, that needs services, is there a way to have that sort of similar model or system in place where there is a seamless sort of continuation of care and services through either MOUs or partnering with DOHMH on that?
So I thank you for that question. I think it's important to emphasize again how important we find mental health, and that we are wanting to continue the conversation about this bill and about many of the ways that we can fully work with the sponsor and the council in order to fully realize the intent of the bill.
If I could just chime in, providers do warm handoffs with clients to services in the community. So that is a part of our regular protocol, because we absolutely do have an expectation around referrals. In addition, many of our providers have more formal linkages with services that are in that particular community. Those are usually relationships that are brokered directly between the not-for-profit provider and the referral agency, but we're happy to talk to DOHMH and see if they have some thoughts about how we can make it a little bit more global at the agency level.
Because it's also, sorry, just one quick comment, because it is actually relatively easy if you have the license to operate an outpatient to do satellite services at, for example, places like shelters and other locations. So that would also be another, hopefully, possibility to look at as well. Okay. Okay. Sorry.
Did you, are you done, Councilmember Lee? Okay, I just want to recognize that we've been joined by Councilmember Ung and Councilmember Brewer. Councilmember Brewer?
Thank you. This might be a little bit off topic, but my question is sort of the Roseanne Haggerty kind of question. Can some of these services be provided before people become homeless so that they don't end up in the shelter? What is the effort toward that? With ACS, for instance, we are working really hard to keep children with families. But what does DHS do along those lines? That's the Roseanne Haggerty question.
Thank you, Councilmember. So the goal of DSS is homelessness prevention, one of their goals, and we work also to that end to make sure that there are the services that are provided to our clients are services that in the end will allow them to not have to enter shelter, but when they do enter shelter, we want to make sure that these clients are serviced as well and with dignity as they can be. I think maybe there's some more specifics my colleague can add.
Molly knows me very well.
Sure. So I point to a couple of major initiatives that we do on homelessness prevention, and these actually live at HRA, but are very important to DHS. Home base, obviously, is hugely important, where clients can access one-shot deals, cover utility arrears, potentially qualify for a city HEPS voucher. I think you know that spectrum of services. I think the legal services is another huge client homelessness prevention tool that has been really effective. we have spent a lot of time thinking about how we can expand homelessness prevention, how we can do it more. There's challenges with information. There is not a great way to, if you look at people based on income or even eviction status or all kinds of things, like some people end up in the homeless system and some people don't, and understanding how to best target those resources, like there aren't wonderful data. I know a lot of people who are much smarter than me have spent a lot of time trying to do that prediction, and it's really challenging. So absolutely, homeless prevention is a priority, and we're really proud of the initiatives that we have. Totally open to looking at ways that we can focus it, but understanding that it is a challenging place to understand exactly where to direct resources.
Thank you for now.
Thank you. Are you ready? Or yeah, okay. Councilmember Caban.
Thank you. So I want to ask some questions about Intro 229. And just would like to start with why the utility allowance got factored into the value of the City FEPS voucher in the first place, and then sort of the follow-up questions are, can you explain why approving Intro 229 would mean that DHS couldn't otherwise pay people's utilities? Is it a lack of funds or some other barrier? Is there a regulation that would prevent it? And then, also why were utility the first piece of why were they originally included, and whether those other barriers exist or don't exist.
I will immediately give that question to my colleague who.
All right. Sorry. So this one gets very wonky very quickly. So I am going, but bear with me. So the intent here with utility allowances and the way that this works in Section 8 is that tenants are paying 30% of their income for housing costs. Housing meaning their share of rent and utilities. Because you actually have to, set this in advance, it's based on a utility allowance rather than actual month-to-month bills, but 30% of their income is going to housing costs writ large. That is not, I will, fully concede that the way City FEPS is working right now, that's not exactly how it's working, but we are in the process of a variety of technological changes that will allow us to do that. And I think the best way for me to explain this is to actually run through sort of a hypothetical example. I will caveat that all of my numbers here are fiction, but I think it's the best way to explain it. So if you have the rent is $2,000 for an apartment, the 30% of the tenant's income is $300, and the tenant share is, and the utility allowance is $100. The way it works in Section 8 and the way it's going to work in hopefully not too distant future for City FEPS is that the landlord collects $1,900. The subsidy payment then is $1,700. The client is paying $200 in rent and $100 in utilities, right? So the client is, despite the fact that the client has to pay their utility bill, they are still paying only 30% of their income for that housing cost writ large. If we were to do it the way the bill is structured with that same $2,000, right? The subsidy payment is $1,700. The client then is still on the hook for $300, and they are on the hook for their utility allowance. So the client in that case, the tenant, ends up paying $400, more than 30% of their income in total housing costs. So, and that is assuming we are holding the city cost harmless. If we said we're going to have the higher rent, but keep the client, the tenant harmless, then that increases the cost to the city. It's a direct transfer to the city to a landlord in exchange for not providing utilities, which I actually think is really counter. I understand the intent of the bill, but I think it is really counter to the goal, right? So we want to align with Section 8, which is trying to hold we want landlords to provide utilities whenever they can. If they are not providing utilities, we want them to be financially accountable for the fact that they're not providing utilities, and we want to ensure that tenants are paying no more than 30% of their income in housing costs. We do need to make technological changes to our system to be able to do that. So I fully acknowledge it's not exactly how City for HEPS is working now, but it is where we are headed, and the bill would really prevent us from doing that. The reason I think that we are doing the utility allowance deduction now, even though we don't have the technological tools in place to do exactly what I just described, is because we, the administration, but also in very close collaboration with the council, worked hard to get all of these different subsidies aligned, right? So City FHEPS, Section 8, EHV, and very shortly State FHEPS are all at the same rent levels, so that you don't have landlords really picking and choosing which subsidy and which client they are going to go with. And so keeping that equity across the different subsidies is, we think, really important.
So I'd like to actually have a little bit. Can I have a little extra time? I wanted to ask some follow-ups on your hypothetical and then offer a hypothetical of my own. But I took in the information you gave, but I think one of my questions sort of still remains a little bit unanswered in terms of there being, is there a regulation that would prevent another avenue or mechanism for utilities to be subsidized or covered? I think maybe you alluded to it a little bit of like, is it a lack of funding, for example, that would prevent it? But like, just very interested in whether DHS could otherwise pay people's utilities outside of like this current mechanism. And, to offer sort of an example that we got a lot of feedback on, and people shared with us a lot, which was part of the reason for introducing this bill, was that civil, indigent legal services organizations, and also people who have been navigating the City FEPS programming, was just how difficult it was. Even as a New Yorker who has the means to be able to rent a market rate apartment, for example, it is a horrible and demoralizing process. It's really, really difficult. And so imagine somebody that's navigating that with the constraints of, the voucher system and things like that, and going and looking for an apartment, finally thinking that they found one, and I heard the story many times over, finally thinking they found one only to find out that actually they are not eligible because of the utility allocation, then not being able to rent, and getting feedback from both the folks navigating that system and the legal assistance that they were providing about the ability to take this out of the voucher would open up eligibility for a lot more units. Presumably, and so connecting that that very real experience to, again, that initial question of what are the other mechanisms for DHS to otherwise pay those utilities?
We really don't have a mechanism to pay utilities in any other way. There's the federal state heat program, but that's really focused largely on homeowners. I don't think it fits that well for renters. So,
but could you? Because again, is there a regulation that would prevent it and not allow it?
This is a place where I would want to talk to our lawyers, but I don't. In order to be able to make a grant program, I have to have a regulation that does allow it, as opposed to not something that just prevents it. So as far as I know, I don't have a mechanism to create that program, but that's something that we can certainly talk to our legal team about. But I think, really more fundamentally, paying the max in every circumstance creates an incentive for landlords to do the least possible in terms of paying utilities, right? So this becomes a transfer from the city to landlords for providing less good service, which I think is problematic. I think we really want to be in a place where we are incentivizing landlords to be paying utilities, because if they are paying utilities, then they actually do qualify for that maximum rent. I absolutely think that there's more education that we can do to explain how the utility allowance works. It has successfully worked in the Section 8 program for decades. So I think there's room for us to make sure that we are talking about it more clearly. This has only been we didn't previously do the utility allowance when the rents were so much under the fair market rent, but it was something that we implemented when the rents were brought up to fair market rent because we were, again, aligning all of those different subsidy programs.
And is there something to point to that sort of concretely shows that it is not just very likely, but highly, highly probable that the outcome of this kind of policy change would absolutely result in landlords changing their already predisposed offerings?
This is anecdotal information. I don't have quantitative data on it, but we've absolutely been seeing an increase in things like electric heat, which is billed to the tenant. Right, there's been sort of I've heard stories recently which really shocked me of individual water meters for tenants, which is I've worked in the affordable housing space for decades. I'd never seen that before. So I think there is definitely a push where landlords are devolving utility costs to tenants, and it can be really high. And if you have a rent that is where you're paying 30% of your income in rent and all of the utilities on top of it, it becomes very challenging to be stably housed.
Thank you.
Okay, thank you. I'm going to ask a few questions, and I just want to say that we have we may have a vote, so some of us may have to run over. But Councilmember Stevens has generously agreed to chair in our absence. But I have a question regarding Intro 513. This bill would require, basically I'm not even going to read the whole bill because we already read it and it's redundant, but is there any reason why a family would need to go specifically to the path? And I get that there was a conversation a little earlier, you explained the ability to really manage more efficiently, right, because of the different services that were being provided at PATH. It makes it easier to centralize everything. However, I have a question because during the pandemic, families were able to do a lot of, or not able, but they were restricted to doing a lot of that via telephone conferencing from the intake center with the caseworkers. What prevents them from being able to do that, say from a community-based organization that's already partnering with DHS in Brooklyn?
Thank you for that question. I think, I'd like to reiterate that we continue to be willing and wanting to continue the dialogue around this bill as well as others, and to take into consideration everything that's being said here at this hearing. We obviously place a value in having the centralized apparatus and being able to work through that. And so that's something that we've been able to discuss here today. And I wonder if my colleague has anything to add about your scenario.
Sure. I think I'd get that right eventually. We did make accommodations and changes during the pandemic to protect public health, but I think we also felt like they were in some ways very much less than ideal. When you are doing a phone intake, you can't, and trying to screen for domestic violence, for example, you can't know if an abuser is in the room and dictating what's being said, right? Whereas when we're doing intake in person, the adults are separated to do a domestic violence screening. It's something that's important because something like 50% of the heads of households in the Families with Children system have a domestic violence history or are survivors. So, we want to have eyes on children where we're doing both health and ACS screening. So, yes, the phone was an appropriate emergency public health response, but we think it's less than ideal over the long term.
I think the pandemic taught us, a lot of, in regards to how to pivot and kind of think outside of the box, right? Like, I don't think that I ever need to have another in-person meeting in my office unless it's absolutely necessary because of the convenience that it brings not only to my staff, but to the person that's coming to visit me. Not having to travel, is a really big deal. But I'm trying to look here because I had a constituent that was texting me from PATH a few months ago during the pandemic, but not too long ago. This is a couple of months ago. This was in June, as a matter of fact. And he and his family went to PATH and had been waiting there. This was on actually June 28th. They were waiting at PATH since 9 o'clock in the morning, and it was upwards of 10 o'clock that evening that we were still going back and forth. And he said, we're sitting here basically waiting for a call. And I said, a call from who? He said, I don't know. They told us that we're gonna get 3 calls. We got 1, so I'm waiting for call number 2, and then we have to wait for call number 3. I guess that those were the protocols that were put in place because of throughout the pandemic, right? But he wasn't sitting there waiting. He and his family were not sitting there waiting for any, to speak to anyone, but rather to provide information that I think could have conveniently been provided from someplace a little bit more comfortable, especially because they had children with them. And it becomes, I think it's very difficult to kind of describe it unless you've lived it. There's a very overwhelming, feeling that, of a failure, of uncertainty that, takes over you when you're in a situation like that. And I think that what the council members here, through these pieces of legislation are trying to find is what is the best way that we can do this. And I understand that this is not easy work. And I applaud, the agency's commitment to trying to centralize these services and to try to ensure that there aren't, as many gaps in services as we can eliminate. But I think that there is a real possibility to do some of this work by partnering with organizations that already have established relationships and contracts with DHS, right? So that way the information is coming from a trusted source. And I just, I would ask that, there be maybe, a few more conversations with Councilmember Ung about, that possibility, because if we did it during the pandemic and we were able to do it successfully, unless proven otherwise, then I don't see why it would be that difficult. I'm gonna give this over to my best friend here, and I will be right back.
Sorry, guys. So the next question we're going to ask, does the administration currently collect the information that the bill requires in Intro 421?
Thank you for that question. So, as I stated in my testimony, that there are portions of the bill that are duplicative of other reporting bills, specifically Local Law 79 of 2022, and then there are also portions of the bill that is as it is written, where we do not collect data and require a interagency connection, which is for the purposes of this bill and how it's written, may be an issue and provide an issue around parental consent and also privacy for minors, and that includes ACS and DOE.
So I just want to make sure I'm clarifying. You collect some of this information, but not all of it, but some of the issues around just parental consent.
The issues to be more specific, the ones that we're talking about specifically around privacy and parental issues are with DOE and ACS.
Okay. So with intro, I'm gonna have, my next question is, what type of trainings, if any, does DHS provide staff related to customer service?
Molly, could you speak?
Sure. So training is something that is really important to us. Administrator Carter, who's been running the agency for several years now, is really committed to raising the bar on the services that we deliver. Anybody who's met her will have heard her use that phrase. So we have an entire team that is working on training. We recently rolled out an online system that we can use to provide training on a really diverse array of topics, to not only to DHS staff but to all of our providers. We work with more than 75 not-for-profit organizations in 400 different buildings, so the online tool is really valuable. It allows for both pre-recorded trainings and also instructor-led live trainings. We are in the process of working through the technology issues to get all of our providers access to that, but we have already created and teed up a really robust array of trainings that cover topics like culturally competent service delivery, de-escalation, really logistical and operational trainings around, how DHS does bed management and sort of very technical specific DHS topics. There is Homelessness 101 to make sure that people understand the context of the work that they are doing and why they do the work that they do, because frontline staff who are disconnected from the leadership may not always have that context. So we have training that is very specifically related to security, and then also to different roles, to housing specialists, right, range of different roles. So I'm really excited that we are going to be rolling all of this out more aggressively, and that this online system is going to allow us to reach people very efficiently.
So I think for me, some of the follow-up questions, even around this is specifically, this was asking about customer service, and none of the trainings you mentioned were around customer service. And then on top of that, to have online training around customer service, it takes away some of the value, right, when we're talking about interacting with humans and how you're giving quality of care, and then saying we have an online training around that. It seems a little like it's disconnected, which is why I think this bill is being pushed around. Like, how are we interacting with folks, and what does that look like? And that human perspective, because online is nice, but like, how do you then follow up with that? What does that look like? And so I would love to hear, like, what does your in-person trainings look like? Is that something that's happening now? Like, yes, it is much more efficient, we can say, but is that what we really should be moving to if we are seeing issues with customer service?
So I think customer service in the DHS context, at least the way that we think about it, encompasses things like language access, like de-escalation, culturally competent service delivery, the array, and we can certainly follow up with a more comprehensive list of the trainings that we offer. But while we don't necessarily have something that is called customer service with a capital C, capital S, I think the different components of what goes into customer service is about how we, the agency, and we, our provider staff, interact with clients, and how do we make that a positive experience for all involved. That's how I think about customer service, and that is absolutely what this array of trainings is designed to do. I hear you about online. The reality is we have, tens of thousands of staff people when you look at the provider staff, right? It is particularly some of the frontline roles. staff do turnover, right? So how do we make sure that there is regular, routine access to training, that we are conveying the information that needs to be conveyed, that people are getting consistent information, having that documentation, having processes where we can roll it out across that very diffuse system is really important. Hear you on the in-person, and we're happy to think about ways that we can incorporate more of that.
Yeah, no, I mean, definitely, but I think sometimes with the thought around like cost efficient or efficient, we say, oh, we'll do online, but understanding that when we're dealing with humans, we also need to be dealing in that way, in the same way, even when we're rolling out trainings, and what does that look like? And I think, yes, de-escalation, all things are nice, but that is not necessarily customer service, right? It is how are we interacting and showing up each and every day. And because a lot of your frontline staff are always on the front line, they often get hit with a lot. So sometimes you need refreshers on what that looks like, on how to interact with folks who are coming to them in a very vulnerable state. And in those times, they need to be able to react in that way. So I think it definitely is needed to be thinking about how are we servicing the people who are coming into these places who need help. And, you know, customer service is part of that, and that should be top priority of how we're making sure we're providing a service to them. So I'll yield the floor back to our chair, who's back.
Actually, Councilmember Ressler had a couple of questions. Councilmember Ressler?
Great. Thank you very much. Molly, it's good to see you. Big admirer of yours. Enrique, it's good to see you as well. Look forward to working together. And I just want to thank Chair Ayala for this hearing and bringing forward a really great set of bills. So thank you for giving the council the opportunity to engage on these issues. And, you know, want to thank all of the providers and advocates who are here, like Vocal and Win and others who are doing such critical work every day. I'm strongly supportive of many of the bills in this package, disappointed by the testimony to hear your opposition to just about all of them. You know, from expanding mental health services in our family shelters to ensuring that families receiving FEPs are not paying utility allowances. You know, there are many really good pieces of legislation. Appreciated your testimony explaining how you're working through the utility allowance issues. I think we need solutions really fast on that. So anything that we can do to work together to expedite implementation to ensure that individuals moving out of shelter are not paying the utility allowances who are receiving vouchers is critical. You know, we want to help, and it's critically important. But the thing I wanted to focus on in my questioning was Councilmember Ng's bill around decentralizing PATH. I think, personally believe it's a disgrace that we have one intake facility for the city of New York for all families with children. I was looking through the data, and do you know which neighborhood or which community district in the city of New York sends the most children or sends the most people into our shelter system each year?
I have the data from by borough. I don't have it by community district, but the prevalence is from the Bronx.
My recollection is that the community district that sends the most people into our system is East New York, District 5 in Brooklyn. Do you know how long it takes to get from East New York to PATH?
I certainly understand that it takes some time. Yeah.
85 minutes, 90 minutes on the train in each direction. That is a very long commute for a family. That is a whole day gone just in transit. What was the acceptance rate at PATH in 2021?
It's data doesn't. We wouldn't think about it as an acceptance rate. Nobody gets turned away, right? When
Certainly they do, right? I mean, go ahead. I'll give you a chance.
When a family comes into PATH, they go through the screening process. The first thing, they go through an initial screening process at intake. Everybody gets a conditional placement. So everybody is placed, I should caveat, a family might be diverted, right? Meaning a one-shot deal is gonna, or a city HEPS voucher or something else is going to solve their problems. But anybody who is pursuing shelter is given a conditional placement.
Deputy Commissioner Park, with all due respect, that's a very rosy assessment. I do not agree with it. 24% of families were accepted into shelter last year. They may receive a conditional placement for the night, but they're told the next day that they are not welcomed in the shelter system. That is the facts. That is down from 45, 50% just a couple years ago, which is not an acceptance rate that I think we should be proud of. But 24%, 3 out of 4 families applying for shelter on their first occasion are rejected.
With all due respect, let me clarify how the conditional placement process works. So people are given a conditional placement. That is a 10-day conditional placement. So a family is in place it's not a bed for a night. They are in a standard tier 2 shelter.
I was being flip, but it's a short-term, very interim placement, and they are then sent packing on their way 3 out of 4 times.
No, if they are found ineligible, they are able to reapply. What has been in place.
Okay, so what was the percentage of people who applied? What was the number of people? No, what was the number of people who applied more than 4 times? The percentage of people who applied more than 4 times to shelter, if I have this data right, you can correct me, Deputy Commissioner, increased from 14% in 2019 to 30% in 2021. So the number of people who applied more than 4 times doubled in just 2 years. And if I have this data right as well, the number of people who applied more than once before succeeding increased from 38% in 2019 to 59% in 2021. So we went from 2 out of 5 families applying more than once before succeeding to 3 out of 5 families, which means people are coming back and back and back again. And you think about that family from East New York who's traveling an hour and a half each way, coming back 3 times, 4 times, 5 times, 6 times. We've all read about the horrible instances of the families applying 20 times, 20 visits to PATH to this one location in the Bronx. I do not understand how we could possibly continue to require these families to travel such a distance.
So I think there's a number of different factors that are getting conflated here that I think are really important to pull apart here. So in the time period that you're comparing, we made some quite significant changes to operations in response to COVID. So the way it worked before COVID was if you were found ineligible, you went back to PATH to reapply. During COVID, we put in place, in order to keep people separate, that you could reapply from your unit. What we found, so first of all of those reapplications that you're talking about, nobody was commuting. They were doing it from the unit in which they were.
Temporarily during COVID, those policies are no longer in place.
No, they still are.
So, they are? You can still reapply without having to go back in person?
At this point in time, yes.
Is there a date when they're no longer when they're being discontinued?
At this point in time, those policies are still in place. But let me, if I can talk through the process. What we found because households knew that they didn't need to come back to PATH, that the process of collecting all of the information that we need to do to look at eligibility was just typically taking longer, that there wasn't the same level of engagement in the process. I say this not to point any fingers. I think there's probably multiple places where that level of engagement, but there were more, non-cooperation cases, things like that, and so it raised the number of reapplications substantially, not because of a policy change around eligibility screening, but because the barrier to those reapplications was a bit lower. That being said, we heard a lot of feedback around the reapplication process and the reapplication numbers, and we made some changes earlier this year to our Families with Children eligibility screening process, looking at one of the reasons why a family might be deemed ineligible is if PATH determines that they have other housing available to go to. We changed our standards for what constituted acceptable other housing, whether or not, if the primary household member was or wasn't a family member, how we handled, if the household, that is potentially available housing is objecting. We will try some mediation. If that mediation doesn't work, that is deemed not acceptable housing, that family would be found eligible. So we have made a number of eligibility screening changes that have affected families' intake into PATH, right? So that we were starting to see that increase the eligibility rate. You're not going to see that in immediate data right now. Just what we have right now is, as I think most people know, just a very, very significant number of asylum seekers because their families' situations are so very different. Most of those are remaining in conditional placements right now for the time being, as we are standing up our sanctuary system for asylees. But so the data right now is a little bit murky, but essentially you were, earlier this year, you were seeing a fairly substantial uptick in families with children eligibility associated with those policy changes that I just made. So, again, people aren't commuting multiple times to reapply. I think
That's a temporary pandemic policy.
The change, even so they wouldn't be coming from, they would be, if they did need to go to PATH, again, they would be coming from wherever their shelter site was, and not with children for reapplications. That's something that is ongoing.
It's a temporary pandemic policy, but welcomed all the same. But
not a pandemic policy that no children at reapplication. We do think there is.
But it's certainly impossible to work if you're coming back 4 or 6 or 8 or 10 or 12 times, an hour and a half each way. I mean, these are incredible challenges. And I apologize, Chair Ayala, I'll shut up after this, but to me, this is a system designed to keep people out. And one of the most obvious manifestations of that is to have one location in the Bronx as far away from places like Brooklyn or Southeast Queens or other parts of New York City as you can possibly get. And we should be providing shelter to everyone we need. When we're rejecting 3 out of 4 families, that's a problem. That is a real problem. And that people who need help and support are not getting it. And we're sending them through the ringer and making it so hard and causing such trauma in that application process that is designed to keep the door closed. One of the most obvious ways we can change it is by decentralizing PATH, having an intake center in each borough. And if no one else, I'm happy to say we would welcome it in the 33rd Council District. It should be in Brooklyn. Downtown Brooklyn is an easy place to get to. I'm happy to help identify a space for you all. I've gotten a location in mind even. We can have that conversation, but we should decentralize PATH. And if you're all not prepared to do it, then we should pass Councilmember Ng's bill tomorrow to get that done. Thank you.
Councilmember, I'm very grateful for your openness to shelters. It has always been a tremendous pleasure to work with you and your team. I do think there's very real reasons why the services that we are able to provide at a single co-located site and the efficiency that we can get in actually making those the shelter placements are really valuable things that it would be programmatically very challenging to lose.
I'm confident that we could consolidate and co-locate those services in Brooklyn as well. So I look forward to trying to make that happen together. Thank you again. I just will say, your all's job is really hard. It's really hard right now with the increase in asylum seekers and folks in need. Appreciate the hard work you do every day to try and look out for the most vulnerable. In giving you all a hard time, it is not coming from a place of, there is respect in the work that you do, and Molly, I know how much you do for our city and for the New Yorkers in need, and I appreciate it, so thank you.
Thank you.
How do we measure the efficacy of the centralization of these services? Like, is someone from DHS physically at the site, trying to kind of, just making an in-person assessment of how things operate and ways that we can be a little bit more efficient?
So first of all, absolutely, we have DHS is very robustly staffed there, and not just the frontline staff, but agency leadership is there on a regular basis as well. We're always looking for ways that we can make operations better. Whether it's use of technology or clearer communications on the process, right? We have children's play space that has been closed that we're working to reopen. It was closed because of COVID, but making sure that we are expanding the services and the benefits that we can provide to clients. I think, frankly, one of the most important things that we can do to make sure that the PATH experience goes as smoothly as possible is really making sure that we have robust shelter capacity to place people in, right? Because
more housing.
Or more housing, but you know, I can talk about the pieces that are more within my control, and that's the shelter pipeline, right? The smaller the vacancy rate, the harder it is to find the unit that is most appropriate for that family, and the longer the placement process can take. So making sure that we have a solid vacancy rate so that we can place families near their child's school, that we can get the right size unit, that if there are accessibility needs, to your point earlier, that we can meet all of those is really important. So really look forward to working with all the members on that shelter pipeline.
I appreciate that. And now Councilmember Salamanca and Holden are not here, but I had a question related to Councilmember Salamanca's intro 1 to 4 that would require, in relation to housing specialists within the Human Resource Administration and the Department of Homeless Services. So his question is, how many shelters in DHS and HRA systems currently have housing specialists, and is there a rate of move-outs into permanent housing that is higher in shelters with housing specialists?
So I can begin by just also highlighting that the agency finds it very important and the primary goal to move out of shelter into permanent housing. And so because this is a goal, we utilize caseworkers in this role that will do out a little bit more than the housing placement, but they substantially do housing placement. And so in those cases that we have caseworkers that work with clients who will then work them through the ability to look for housing. They will have that ability to either be placed within with the site where they actually are, or they visit the shelter site on a regular basis. So in terms of housing specialists, just to get back to to your question, we have that particular work stream under the caseworker basis.
Okay, and so the caseworkers act as...
But I think...
Okay.
Yeah, let me chime in. Virtually all of our shelters, DHS shelters, have dedicated housing specialists. There are a handful, as my colleague noted, that where there aren't dedicated housing specialists and the caseworkers are filling that role, but it is virtually all of them that have dedicated housing specialists, so I can't actually do the comparison of the non because the housing specialist is so prevalent. We also have a team within DHS that can provide of housing specialists that can go out and provide support as needed as well, so they work out in the field. We're doing a little over 200 subsidized placements each week. That is system-wide, so we're really, really focused on permanent housing. It's a huge priority. You know, we were talking earlier about training. I don't know that this certainly doesn't constitute customer service training, but it's something that we're really proud of. We did a 4-day full-time training on permanent housing tools over the summer, and we had more than 600 participants for each of the 4 days. Really saw tremendous engagement in focusing on the permanent housing and on the processes and tools that are available, and we're really seeing that in our numbers. We have strong move-outs.
Okay. And regarding intro 108, so this is a Councilmember Holden's bill in relation to creating an annual report on the performance of Department of Homeless Service providers. Does the administration currently collect that data, the data that's required in this bill?
Again, thank you for the question regarding this bill. We believe that there are certain aspects of the bill that are duplicative of other reporting that we currently do, and also would like to emphasize that there are elements of resources and costs that go into producing reporting at this level, and we want to reiterate that transparency is always something that we want to do as an agency. We want to participate at that level and be a part of working with the sponsor and to really figure out the absolute intent of the bill and then work toward that intent.
What is the total number of providers on the contract with DHS? Do we know?
It's about 75. Many providers have multiple contracts, of course.
Okay. So that's not that many. I mean, I just assumed that it was a larger number. I mean, I just have to be honest that, and again, I get the sensitivity of the matter, and I think, I've never, in our office, we have, I think, 5 staffers in the office at a given time, and, we're trying to figure out ways to help our constituency, right? We represent a 2-borough district, and, we have older adults, people with disabilities, people with children, people who are working, who can't afford to take the day off, but really need to speak to somebody. And so we try to offer virtual options, emailing, calling, walk-in hours, extra, later hours, so that people have, access to us in all ways possible. We work really hard on our customer service skills because we understand that people come in and sometimes are so, tied down, to whatever issues they're going through, that they may, inadvertently take that out on you, in that moment. So we learned that it's not a matter of if it happens or when it happens, how do we react? These are all things that are really important to this body. But with DHS, I think that my concern has always been that whenever I have to counsel someone that has to go into shelter, the conversations are never pleasant to have, right? Because the feedback that we get from just about maybe I would say 99.9% of the people that come in contact, I actually do not have a case where a person came to me and said, I loved my setting, I was in in the best shelter ever, right? And so we have to mentally prepare folks that are entering the system, that are going to PATH. When I'm sending somebody to PATH, I have to say, you have to take a book, take food, take water, be prepared because you're gonna be there all day. And that's the reality. And I think that through this package of bills, what we're aiming for is to ensure, right, that we're addressing what we're hearing on our end from the constituents that are being serviced by these providers. And I'm not in any way, shape, or form saying that we don't have providers that are providing, good quality services, but if there's no real way to measure that, then we're being reactive, right? Whenever something then hits the news, now we're trying to figure out, well, what happened and when that probably could have been averted if there was some sort of streaming process that allowed us to gauge the efficacy of each organization and their delivery of service. If we have an organization that's housing, families in buildings that are substandard, we should know that ahead of time before, something horrible happens. And we're not seeing a lot of evidence to that. And I get it. My mother used to say, when too many people stir the soup, it doesn't come out right. And I think that there's no greater example of that than in, agencies such as DHS and DSS and NYCC, where we're just so large at some point that it makes it almost impossible, right, to know what's happening at every given time. And so I appreciate you wanting to mitigate that by centralizing some of the resources, but we don't, I don't know that works for the general public. And I would really encourage someone to take the train from Brooklyn to PATH, and to take, to have that experience, to really appreciate, and then sit there all day to really appreciate the discomfort and the trauma that we are, putting on families unnecessarily, because there are probably other ways to do things that we just, haven't, because it's, we get comfortable doing things a certain way because that's the way that it's always been done. It doesn't mean that it can't be done any differently. So I would love to see what reporting bill exists now that would conflict with Councilmember Holden's bill, because I actually think that this is a really good bill, and I think that it's necessary. I want to know that my providers are doing the best job possible, and that constituents that I am referring are, having access to the services that they deserve. Most specifically in the single shelter. There was a bill here on de-escalation. We saw what happened a couple of days ago. We forget the people that work at these shelters, they're human beings too. They are forced with, some very difficult situations day in and day out with individuals that have, sometimes substance use disorder, mental health issues, people that are stressed out, that are pissed off that day, that are going to take it out on you. And we saw what happened, right, when someone kind of reacted, right, was kind of caught up in that and reacted in a way that was unprofessional. And I appreciate that the commissioner immediately addressed that. However, that is not the first case where something like that has occurred. I know an individual who has suffers from mental health issues, was punched in the face by a security guard in one of the Brooklyn sites, because he was, probably being inappropriate. However, those security guards should be armed with the resources to learn how to de-escalate and to address an individual that is in crisis, an individual that, may be under the influence of something. And it's just not evident in the work that we're doing. There seems to be some sort of, I don't know, I would call it a donut hole, right, in between what you're seeing versus what we're seeing. And, so the members took a lot of time to help, to get these bills drafted for a reason, and any consideration, any, maybe, communication with each individual office to kind of help us help you, if you will, is greatly appreciated. And with that, I think our final question will come from Councilmember Ung.
Thank you, and thank you, Chair Ayala, for putting it so aptly about why we're here today, dealing with the issues that we are in our districts. And I'm just going to mention again, this is my bill, Intro 132. I have heard a lot back and forth. Actually, I did visit the PAF Center in the Bronx, and I was actually very impressed by the amount of services that was given in the center. And I understand it's not just a center where, you do the process for intake, but it's actually a center where you provide services to people facing homelessness. I guess, not so much a question, but a comment is, cost is a factor of cost, but other than that, what is to prevent providing all those same exact services at a different borough, at a different location for different families? And I also say this because I'm coming from a district in Flushing. Yes, the commute is hard, but moreover, it's also an immigrant community where it's just a very scary experience when someone is facing homelessness, and to tell them to go to the Bronx where they've probably never been before, take this public transportation, go to a new place where they never ever, language is a barrier, and I visited there, and I appreciate that you show me that people there do speak different languages addressing needs of the community. But I'm just coming also from a community where, and that's where I think I also had the other introduction about working with not-for-profits, because often when, a community, an immigrant community, where they're facing a risk of homelessness, they are actually, the first place they would go to is the trusted for not-for-profit. I'm not here to make life more difficult for any of you. I'm just hoping, as Chair Ayala was saying, that we can work together more and see how we could really address these issues for the different communities in New York City. Thank you.
Thank you. I have a final question. Actually, I just received some information that there were 60 individuals that were denied placement last night at the intake facility for single adult men. Do you know why?
Denied placement isn't exactly how I would describe it. We had a very challenging day yesterday. We got bus after bus after bus from Texas. We had more intake yesterday than we would typically see in a week. And we did not place everybody in the time that there were single adults that we did not place in the time that we needed to do it because of just the volume. They've all been placed. We are absolutely doing everything that we can to add even more emergency surge capacity. But I think, the politics that have been played with people's lives and the influx of people is straining the DHS system to the breaking point. We are, the woman who runs PATH was there from noon yesterday till, I was talking to her at 8 o'clock this morning, right? She, it is an incredible effort from public servants to make sure that we are dealing with the volume of clients who need. We understand, we have both a legal and moral obligation. We understand that, but the volume has just been tremendous.
What was the number of individuals that arrived yesterday?
The total system-wide of asylees was close to 500 people.
Yesterday?
Yesterday.
Jesus Christ. So the 60 plus that didn't make it in by the allotted time, did those individuals then leave and come back, or were they still?
They were placed, they just weren't. Sorry, they were placed, they just weren't placed in the time frame that they should have been.
Okay. How are we doing in terms of capacity building? I know that the vacancy rates were really, really, really low. And I really do, I don't know how you guys are getting through. It would, even if we had planned for the worst case scenario, I think we would still be kind of in a jam, but I can appreciate how difficult it must be to identify places to properly house families and individuals, and I'm wondering how is that going?
It's certainly challenging. We've been opening hotels very rapidly. I think many of the council members have heard from us, and you will unfortunately continue to hear from us with very last-minute openings. Really grateful for the providers who have stepped up. We have, agency staff that are working extra shifts to help staff these emergency facilities. But we are moving as absolutely aggressively as we can to keep up with the volume. We had a gap in that volume last night. We should be in a better place for this evening.
Was it can you share, was it a processing issue, or we just didn't have places to put folks?
It was the volume of people coming in, and then the way single adult system works is that people are placed in assessment beds first, so that was a volume of assessment beds, a volume of people coming in. But I think it was really, having multiple buses show up at 30th Street late at night that all at one time that caused that bottleneck.
Appreciate that. Okay. All right. Thank you so much. Again, I can appreciate how difficult this time, has been, and this body is here to try to be helpful to the best extent of our ability. But we really are working hard to address a lot of the issues that have been raised by the constituents that we represent, and average, New Yorkers that are going through a really difficult time. So thank you for being here today, and for sticking it through. And I look forward to having more continued conversations about the issue with the asylum-seeking families, and how we can be helpful there.
Thank you for having us.
Thank you.
Now you can do the time.
We will now be calling on members of the public. I will call up individuals in panels. Once your name is called, you may begin your testimony once the sergeant at arms sets the clock and gives you the cue. All testimony will be limited to 3 minutes. I would like to note that written testimony, which will be reviewed in full by committee staff, may be submitted to the record up to 72 hours after the close of this hearing by emailing it to testimony@council.nyc.gov. The first panel will be an in-person panel, and it will consist of former Speaker of the New York City Council, Christine Quinn, Deborah Berkman, Robert Desir, and Nicole McVinua.
We can begin. Welcome.
Thank you. Well, thank you, Chair Ayala, and the other members of the committee who are here and who have been here today. My name is Christine Quinn, and I'm the President and CEO of WIN Women in Need. And I'm here to express our strong support for and discuss the importance of Intro 522, which would require the city to fund on-site mental health clinicians at every shelter for families with children at a ratio of 1 clinician for every 50 families. WIN is New York City's largest provider of shelter and services to families with children experiencing homelessness. We operate 14 shelters and nearly 600 supportive housing units across the 5 boroughs. More than 6,200 people call WIN home every night, including 3,490 children. In total, we house over 10% of all the homeless families with children in the city of New York. Becoming homeless and experiencing homelessness in and of itself is a traumatic experience. Every family living in shelter in this city, including those at WIN, have experienced trauma, from being evicted to fleeing an abusive partner to navigating the city's onerous intake system for homeless families, as you guys have discussed. Many of those families also have unaddressed mental health needs such as PTSD, depression, or substance use disorders. I want to thank the sponsor of 522 who just joined us, Councilmember Eric Botcher, and as he mentioned at the press conference, I may go over 3 minutes. I hired him for his first governmental job when he was 28, and now look, he's in the seat I used to hold. Pretty damn good if you think about it. Yeah, well, there you go. Sorry. Where was I? Okay. A homeless shelter should be more than a roof over a family's head. The time a family spends in shelter is an opportunity to eliminate barriers to mental health care by uncovering their needs, reducing the stigma, and initiating treatment. To truly support families in their journey towards wellness and permanent housing, family shelters need clinical resources to offer their residents. That is why WIN worked hand in hand with Councilmember Boscher, our clients with lived experiences, shelter and mental health providers, and advocates to develop this bill. As mothers experiencing homelessness fight structural barriers, many also face complex personal histories. Trauma can impact people in ways that are subtle, insidious, and destructive in both the short and long term. Mental health and substance use issues are more prevalent among adults with exposure to traumatic events and circumstances. Given the intersectionality of trauma and homelessness, it's not surprising that mothers experiencing homelessness are disproportionately likely to suffer mental health needs and substance abuse disorders than those who are not. Research repeatedly finds alarmingly high rates of psychiatric disorder amongst homeless mothers, most commonly PTSD. Now, I'm not going to go on and on because it's only 3 minutes, but let me just say in summary that this is a challenge for all of us who run shelters, for families, that we don't have funds that specifically can be used for hiring or contracting with clinicians. At WIN, we probably raise more private money than any of the other providers just because we're bigger, and we still don't have the money to set aside for this, for this and for these types of clinicians. 2 weeks ago, one of our clients, we gave them a mental health referral to the Floating Hospital, which is an excellent partner, 3.5 month wait till the first appointment. And we all know the first appointment, nothing really happens, right? And we have constantly, on a regular basis, particularly children who demonstrate suicidal ideations. And I'm telling you, when the police come and EMS come and they take them to the hospitals, 9 times out of 10, they just come back the next day, and 8 times out of 10 without a referral. This bill will not only help people do better when they are housed, which is the critical issue, and remain independently housed permanently, it will also save lives. And I'm just so grateful to Eric and to you, Madam Chair, and to the veto-proof majority that is on this bill, because often our mothers feel forgotten. They feel like they're for the forgotten face of homelessness. And you have said to them today that they and their children are not forgotten and will not be forgotten as long as this city council sits in these chairs in this esteemed building. So thank you very, very much. And just lastly, I want to say, all of your questions were effing fabulous. You were on point. You got it right. I was so impressed. I don't mean to sound patronizing if that does, but really so good. You again, I don't want to sound patronizing, but you made me proud. I believe in this institution, and you made me proud. So thank you. Thanks. Sorry for taking too much time, people.
No. That's the power of having people, representatives with lived experience representing you on this body. And thank you for all that you do. I wanted to share, because former Councilmember Quinn, I shared my experience this morning, but I have my oldest son, who wants to be my favorite son. He's not. The little one is the favorite. But he, and I'll go on record, they know, it's not a secret anymore. But he was a very difficult child. And, I was going through the shelter system. His father had been, murdered while I was pregnant. I was a teenager. I had no sense of direction. My mother didn't understand me. I didn't understand her. And I remember, vividly, this kid he had attention deficit hyperactivity disorder, and his mother was 16, 17 years old and didn't know what ADHD was. All I knew was that everybody would close the shutters on the door and pretend they weren't home when I was on my way because they didn't want to deal with him. And I felt even further isolated because I felt like, he was somehow preventing me, right, from being able to live, like any other young mother. And I remember being at home with him one day, and he was just everywhere I would go, people would say, have you taken him to see somebody? Have you taken him to see somebody? Because he was he would jump out of the building and fly through the stairs. He was bruised and cut, and I'm telling you, he's a wonderful human being today. He's a functional adult, but he was a horrible baby to take care of when you're 16. But I remember one day, it was a really, 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 really bad day at home, and I share this story, and people sometimes tell me, why do you share this story? It's a horrible story, but it's an important story because it's a true story. And that day I just, I don't know what happened, but I remember grabbing him through his shirt and shaking him so aggressively, and I dropped him. And I thought, oh my God, I wanted to hurt him in that moment. I was just so blinded by everything, the stress of it all. And I remember picking up the phone and calling, and trying to make an appointment to see a psychiatrist for him, because I thought obviously he's the one that had the problem. And I couldn't get one. And I was at my wit's end, and I said, the last person I called, I said, if you don't give me an appointment, I'm jumping out of the window and I'm taking him with me. And they immediately gave me an appointment. And I was not gonna jump out the window, obviously, but I felt so suffocated in that moment that I knew enough to recognize that I needed the help, but the help was not readily available for me. And the fact that I had to say that to be able to access that level of care speaks to the dysfunction that we have in a city, New York City, one of the richest cities in this, in the world. And we still, my son is 32 years old now. I know I look like a baby, but he's 32. Remember, I was a teenage parent. And, and still 30 years later, we're having the same discussion about the need and the importance of mental health services for families. I really applaud you, and I want to thank, Eric, obviously, you've been a champion of this, but most people don't understand, and my hairs, stand as I say how important this piece of legislation is and the impact that it would have on so many families. So thank you, and thank you.
Well, Deputy Speaker, thank you, because, we can have, I think everyone on the panel will agree, we can have a million statistics, but at the end of the day, the whole packet of legislation today is about people, and you put a human face on this in a way that is powerful, given the positions that you have reached in your lives. Many people would hide in shame, which we would not want, and you've broken through that, so thank you for that.
Thank you. You can proceed.
Thank you for sharing that. Deputy Speaker Ayala, council members and staff, good afternoon. Thank you for the opportunity to speak to the Committee on General Welfare on all of this legislation that will impact people experiencing homelessness. My name is Deb Berkman, and I'm the coordinating attorney of the Shelter Advocacy Initiative at the New York Legal Assistance Group, or NYLAG. The Shelter Advocacy Initiative provides legal services and advocacy to low-income people in and trying to access the DHS shelter system. NYLAG supports all of the legislation introduced today, and I have provided you with written testimony supporting each of the bills. But because I only have a short time, I'm going to focus on a few bills. I want to start by responding to something that the DHS representative, Ms. Park, said about Intro 92. And I assume, she said this as part of, I think, trying to explain what a good job the DHS was doing, dealing with people's disabilities and accommodating them. And one of the things that she said is that DHS now has a disability affairs coordinator. While it is true that DHS does have a disability affairs coordinator, they do not have a mechanism to help people find providers to get the reasonable accommodations that they need in order to get the changes to the system that they need to access shelter. So many of my clients who are experiencing street homelessness would be able to come inside if they could get a reasonable accommodation, but they are either they don't have insurance or they have insurance and they're not able to find a provider to give them the medical documentation they need to get either the single room or the relaxation of certain rules that they would need to access shelter. And as a result, they're on the street. I have called the Department of Homeless Services and asked them to help me find providers to create documentation so these people can come inside. And there is not a process by which to do so. They do not have providers to send me to. There have been times that individual employees at the Department of Homeless Service have gone into their own Rolodexes to try to help me get someone inside. But they do not have a process to comply with this part of the Butler lawsuit settlement. So that's a real problem. At some point, I also wanted to respond to something else that was said today. Someone had asked what the current PATH eligibility rate is. I don't know if that person is still here, but I want to report that in July of 2022, the eligibility rate was 18%. So that means that 82% of families experiencing homelessness were found ineligible for shelter in July of 2022. Now, what DHS will say about that is that it's because of the influx of migrants. But that shouldn't be the case, because asylum seekers don't have to comply with all the same eligibility requirements that non-asylum seekers do. So there are not the same opportunities to find them ineligible. So it really doesn't make sense that there should be such a low number. I wanted to support Intro 522, and NYLAG enthusiastically, thank you.
Go ahead, you can.
NYLAG enthusiastically supports the provision of mental health services in shelter, and of course we want to echo everything that was just said about the trauma of leaving one's home, and that clients who opt for mental health counseling should have every opportunity to receive it. We do want to urge protections to be added to ensure that mental health services are only provided to families that voluntarily seek out such treatment, and to make sure that residents aren't coerced into entering mental health treatment and understand that it is voluntary. And also, we want to make sure that there are protections to comply with HIPAA and make sure there are no sharing of information between a mental health provider and the rest of the shelter staff and DHS. We think that NACS, of course, NACS. So that is what we absolutely support this bill. We also want to support Intro 276 that requires DHS to train the public-facing employees on professionalism, cultural sensitivity, de-escalation, and trauma-informed theory. But we would also ask that this council go further. This is a very necessary first step, the training. But we also think that this council should create an effective oversight mechanism to record and investigate the reports of abuse, and if warranted, to impose penalties for bad actors and penal violations where warranted. And finally, we want to enthusiastically support Intros 132 and 513. One intake site for families with children is wholly insufficient for a city this size. In July of 2022, 1,829 families, not people, families, applied at PATH. I represent a number of those families. A number of them, and I know there's been a lot of controversy about this, but a number of those families reported to me that they stayed in the PATH intake center for days on end. They were given food, they were given water, but they slept there. And that is just far too long for them to stay there. And many families who find themselves needing shelter, as many members of this council recognize, have no connection to the Bronx. So creating community-based intake centers would obviously decrease their trauma, but allowing community nonprofits to process the applications would reduce the trauma even further, because a lot of our clients already have relationships with community nonprofits. So they would be going to a place that they and their children already know is a safe space. And we think that would really go a long way to reducing the trauma. Thank you.
Thank you. Go ahead.
Good afternoon. My name is Robert Desir. I'm a staff attorney with the Legal Aid Society. We submitted our testimony already in conjunction with the Coalition for the Homeless. I want to thank the chair of this committee and also the committee for holding this hearing on this important issue of homelessness. We want to mainly talk about Intro 229 and city FEPS. We support Intro 229, which will fulfill the City Council's intention of structuring city subsidies to work as Section 8, and will maximize tenant flexibility in their apartment search. While Section 8 allows tenants who pay utilities a discount on their rent obligation that they can use to pay for utilities, FEPS requires tenants to pay utilities in addition to 30% of their income towards rent. So we support the suggested changes to Intro 229. We would say that Intro 229 should be amended to require HRA to reduce the tenant shares to reflect the cost of utilities, as is done with Section 8, while preserving tenant flexibility to rent apartments at the statutory maximum. We would also urge the council to make funds available for HRA to upgrade its computer system to handle this and some of the other policy changes that I want to turn to. In addition to 229, I think there are a number of other issues that should be addressed in order to maximize the effectiveness of city FEPS and allow as many people as are eligible to be able to use the program and come out of homelessness. I first want to turn to the rent reasonableness requirement. Because of this requirement, someone can find an apartment with a rent within the payment standard only to learn that the rent is not reasonable and that their application will be rejected. In some cases, this determination is not made until after there have been extensive dealings over weeks, even months. This also negatively affects tenants who receive city FEPS to prevent eviction. While they're in court, they may negotiate a rent that will allow them to stay in their apartment, and it's very problematic if they sign an agreement that says this is what their rent is going to be, only to present that rent to the administrators of the program to have that number rejected. So the City Council should eliminate this to ensure tenants are not unfairly prevented from renting apartments at or below the payment standard. Another issue that's causing a lot of people who are in shelter to not be able to leave shelter is the issues around immigration status. Despite there being no immigration status-based restrictions in the laws authorizing city FEPS, many without status languish in shelter because the city has not extended eligibility to them. Further, federal law that seems to limit eligibility leaves room for the city to extend eligibility to those without status. Also, these laws have been found unconstitutional and unenforceable, and they do not preempt the city or state of New York from extending a benefit like city FEPS to any U.S. citizen, non-U.S. citizen New Yorker. I don't know. Okay, so I'll just quickly touch on other issues such as source of income discrimination. I think it's very important that there's a commitment and funding to the Commission on Human Rights so that source of income discrimination cases can be pursued, and that we have staff that can offer real-time solutions and help people who are experiencing this pernicious form of discrimination. Lastly, I would speak to the unacceptable delays that we see in the application process that cause people to wait very long times before they can access an apartment, and actually cause people to lose apartments. The review process needs to be streamlined so that any errors that are uncovered can be addressed quickly, so that communication is such that any issues can be dealt with and worked out without this kind of mechanical rejection of applications and people starting all over again. And meanwhile, time is lost, people languish in shelter, and also lose out on opportunities. I think that the city should set benchmarks for approving packages. Shelter staff should be trained to deal with the systems and to kind of learn the ins and outs of the different programs to assist people in quick order. And there should be processes to make sure that apartments are inspected timely and improved timely, and that's not a source of delay. So these changes, in addition to the passage of Intro 229, would strengthen the City FEPS program and help more New Yorkers move out of shelter. Thank you.
Thank you. Good afternoon, Deputy Speaker Ayala and members of the committee. My name is Nicole McVinue, and I'm the Director of Policy at Urban Pathways. Thank you for the opportunity to testify today. Urban Pathways is a nonprofit homeless services and supportive housing provider. We serve over 3,900 single adults annually across 4 boroughs. And for the purposes of time, I'm not going to read my whole testimony, so please refer to my written testimony for further comments on additional pieces of legislation. But I also wanted to focus on Intro 229 today. At the end of last year, a major step was made towards making the City FEPS rental subsidy more effective by increasing the maximum rental rates to the fair market rent to FMR, which was intended to also increase the number of apartments on the market that were accessible to these voucher holders. But unfortunately, the city's application of the utility allowance has effectively decreased the value of the City FEPS voucher by requiring that the total rental amount include utilities, and when utilities are not included, deducting the utility allowance off the top of the overall voucher value. The current application, excludes City FEPS recipients from accessing a majority of the apartments on the market that are renting on FMR because most apartments don't include all the utilities. And this is at a time when the city is experiencing the largest average monthly rent increases ever. So this undermines the effectiveness of the voucher and prolongs homelessness, which is why we support Intro 229, sponsored by Councilmember Caban. We believe that applying the Section 8 rules, like the administration spoke to, would work with this bill, and that the wording of the legislation would allow for the Section 8 rules to be applied, which would credit back the utility amount to the tenant by deducting their payment amount. So, we agree with the administration that that would be a good application, but we need to make it move faster. I know that we've spoken to the administration about them changing their computer systems and updating their technology. So, we would like to see that happen as soon as possible. I also wanted to speak to, the fact that a lot has come up today about the need for quality services, increased reporting, and all of these things are extremely important. The success of the city shelter system and getting people housed quickly and having quality services is based on the city's investment in the system. And the only way to have high quality services is for our contracts to be fully funded, which is just not the case. And we really need to support the workforce who are the backbone of these services. Our DHS contracts budget minimum wage at $15 an hour for maintenance workers. Right, so that means that our staff are going home and they're worrying about how they're going to feed their own families, how they're going to pay their own rent, and we're just creating this cyclical system. So we really need our contracts to support our workforce so that our workforce can be focused on what they're doing, providing the best quality services as possible, and also so that we can maintain a qualified workforce. I know I'm out of time, but I just wanted to say really quickly that, our organization is at a 32% staff vacancy rate and has been for months because we cannot pay enough because our contracts do not include enough funding to pay our staff adequately, and so we have this constant turnover. And we know that negatively impacts our clients, right? And that's not what we want. But without the proper funding, it's really, really challenging. And we want to open more safe havens. The city's talking about opening more safe havens, which is wonderful, but the contracts really need to be evaluated at the funding rates. We recently opened a safe haven and we cannot staff it. We have 20 vacant positions, which is causing us to actually outsource to our security and things, which is costing more money in the end. It just really doesn't make any sense. So I hope that the council will consider cost of living adjustments in our contracts in the next budget cycle. We haven't had a true cost of living adjustment included in our contracts in the last 3 budgets. We had a workforce investment, but it's not a continuous COLA that's applied every year. We really that's really what we need if we want to make sure that our services are as high quality as possible. Thank you very much.
Madam Chair, if I could just add 2 points on what was just said. The prior council, right towards the end of the term, passed a piece of legislation that required that security guards at shelters get paid a living wage. So that was probably, 18 months ago by now, maybe 24 months ago. None of us have gotten a penny, not a penny. And when you ask DHS, when are we going to get the money? Maybe by the first of the year, but they don't know. And then the money that was put in by all of you in the budget last year, the COLA or workforce investment or whatever we're calling it, we've not seen a penny of that. And they can't even, maybe Urban Pathways is different, they can't even give us an estimate of when we're going to get that. So we too have big gaps in, in employment, big vacancies, and also we have big retention problems. And employees are now mad because they've seen in the paper money was promised. And then to tell them we don't have it because the city hasn't given it to us for 2 years, it's just terrible. So I just wanted, you reminded me of that.
I agree. Thank you for that. Councilmember Cabal.
Yes, thank you. First, I just want to express gratitude to the entire panel for your testimony. I just wanted to note that the representative from Legal Aid, have your testimony here. Would really love to learn more and dig into the edits that you're suggesting, and would encourage you to reach out to my legislative director, Madhuri Shukla, so that we can engage in that process. Excited to do that. And then just extra immense gratitude to NYLAG, who has been a strong supporter and really helped us with this work. So just really appreciate the work that all of y'all are doing.
Thank you.
Could you tell me the name again? Okay.
Councilmember Butcher.
Thank you to the panel. Chris, could you speak to how we can ensure that if mental health professionals are coming into shelters, how do we ensure confidentiality? How do we ensure that people don't feel pressured to take that care?
So all of the services in shelter are voluntary. We can't, nor do we try to, or Pathways doesn't try to force people, because even if you wanted to force people, it doesn't work, right? Because if people have to want to go to job training, they have to want to go to have their children go to camp or go to recreation or whatever. You can't force it. So I think the way we make sure that works, and we have to work with the council staff on the language of this, but you just say it in the legislation in a way that is legally appropriate, that this is voluntary, one. And two, and I'm not a lawyer, but there must be examples of this in HIPAA and other places within regulations at HHC or DOHMH, that these materials will all be held confidentially. I know when I ran the New York City Gay and Lesbian Anti-Violence Project, or Crime Victims Assistance Agency, all of the materials that were relevant to victims meeting with social workers was confidential. So there are ways to do that, and resources like NYLAG and Legal Aid and others in the medical fields who can help us do that. I know there are concerns by some that they feel that on the single side, and it's just not my area of expertise, I can't speak to it, but I've heard from some folks that they feel that the psychiatric help or psychological help in the single side is used in a surveillance way. That's not what we're looking to do, and I think if you make sure in the legislation that it is noted that it is voluntary and all HIPAA, and even if we can go stronger than HIPAA, because at times I feel like HIPAA, when there are translation issues, gets a little funky. I was recently in a hospital situation where, like, I knew everything about the guy, you know, in the curtain next to me because of translation. He was very sick. But anyway, so I'd like to go even further. But I think we just legislate, you know, we put it in the bill, one. Two, if we want to, we can set up some kind of requirement of training for providers, right? That we train them on what it means to be in compliance with HIPAA, train them on voluntary if we think that, you know, is necessary. That I don't think would be, you know, any kind of a problem. Third, I just want to say, I know the issue of a lack of psychiatric or psychological professionals has come up, and that's true. And I really want to thank Chair Lee, who's been giving us a lot of time to help us, you know, thought process around this. When I was speaker, we had a similar type of shortage of nurses, particularly nurses who spoke more than one language. We created a partnership with Hunter for an accelerated but high-quality program that brought people to, you know, having nurses degree, and it made a big difference. And I know that Hunter and other CUNYs would be interested in doing this here. Maybe that affects implementation also, but those are all things we can work out, and it's great to have the resources of groups like NYLAG who are willing to help us do that.
Thank you. Any other questions for this panel? No? Okay. Thank you all so much.
Thank you.
I will now call on the next panel, which will be a virtual panel. For those virtual, remember that there is a few second delay when you're unmuted before we can hear you. That first panel will be Eric Lee, Jacqueline Simone, Amy Blumsack, and Juan Diaz. We will begin with Eric Lee.
Hi, good morning. My name is Eric Lee. I'm Director of Policy and Planning for Homeless Services United. Thank you, Speaker Ayala and members of the General Welfare Committee for allowing me to testify today. I will be summarizing my written testimony for the time allotted. HSU is grateful to the Council for its steadfast leadership on homelessness and affordable housing, and we stand ready to work with you towards implementing solutions to strengthen and improve services for families and individuals experiencing homelessness. The city's homeless services safety net can meet the current and future need by focusing on three priorities: bolstering eviction prevention and legal services to meet the overwhelming demand, establish a reliable DHS shelter pipeline to create purpose-built, service-rich shelters, and normalize the fiscal operations of homeless service providers, and expedite the placement from shelter into permanent housing to shorten the time spent homeless. Regarding the legislation discussed today, HSU supports Intro 229 to remove rent utility deductions from City FEP's vouchers, and we would also support legislation to remove rent reasonableness tests from City FEPs. For Intro 522, while HSU members support additional mental health services in family shelters, mandating staff positions and case ratios could make it difficult for smaller providers to comply with the bill, given their lower than case ratios. We have 2 small providers that currently cannot find an LCSW for over a year now because of the case ratio. And for larger providers, this bill would not allow them flexibility to enhance their existing services with higher levels of care, such as hiring a psychologist at a 1 to 200 case ratio to complement their LCSWs and be able to prescribe medication for clients. For intros 132 and 513, HSU supports a no wrong door approach to shelter. And we think that single adults would also benefit from additional intake centers and the ability to be directly placed into shelter by providers. Single adult men often refuse to go to 30th Street Intake Center, and providers see individuals with mental health diagnoses being discharged from hospitals and prisons, but lost to the streets because they cannot place them directly in adult mental health shelters. For Intro 190, HSU broadly supports the intent of the bill to publicize the rights of people experiencing homelessness. And we recommend the bill include references to where each right is ensconced into law. Excuse me. For Intro 92, we support making shelters more accessible spaces and recommend monitoring the progress off of ongoing efforts established by the Butler Settlement. For intros 108 and 421, we support measuring outcomes to improve the performance of the sector, but feel that measurements should be made in the context of shelter sizes and program models rather than specific
Time's
providers.
expired.
If I could just,
If you can just wrap it up.
Thank you. The council may want to consider combining intros 108 and 421 and complement the data reporting bill established by intro 212 to look at how lengths of stays within different shelter types and sizes correlate with specific exits from different types of housing to better understand the effectiveness of housing resources for specific populations. For intro 124, we support extending housing specialists to HASA and DV shelters, but the city must commit additional city tax levy dollars for DV shelters, given that per diem rates are set by OCFS. And we also have significant concerns about the reporting requirements in this bill, given that it could be misappropriated by NIMBYs and also would not improve the provision of housing specialist services. And finally, for training bills 276 and 431, the department would need to be responsible for developing the training curriculum and identifying vendors for shelter providers to be able to easily comply with the legislation, as well as additional funding to ensure that providers are able to budget for the additional training services. Thank you for the opportunity to testify today.
Thank you.
Thank you, Eric. Next, Jacqueline Simone.
Thank you for the opportunity to testify. My name is Jacqueline Simone, and I am the Policy Director at the Coalition for the Homeless. We submitted joint written testimony with the Legal Aid Society, who already discussed Intro 229 and needed improvements to city facts. I'd like to highlight a few other bills today. We support Intro 92, which would create an advisory board for accessibility at shelters. For too long, homeless New Yorkers with disabilities have encountered a lack of accessibility when they seek services in the DHS shelter system. The advisory board would complement the work being done as part of the settlement in the landmark disability rights lawsuit, Butler versus City of New York, in which the coalition is an institutional plaintiff. As the city endeavors to make the shelter system more accessible for people with disabilities under this settlement, an accessibility advisory board could identify and propose additional reforms. We are pleased that the legislation requires that at least 2 members of the board have lived experience of disability and homelessness, and we urge the council to increase the number of such members. We strongly encourage the full spectrum of disability experiences to be considered in the creation of the advisory board. The council should also ensure that the recommendations of the advisory board are given thoughtful consideration and that there is accountability regarding whether their suggested reforms are implemented. Several members of the coalition's disability focus group are also here today to testify about this bill, and we thank them for their advocacy and expertise. We also support Intro 124, which would ensure access to housing specialists. Well-trained housing specialists with manageable caseloads are a critical resource in helping people move into permanent housing. However, the city must also equip these staff with a range of housing options to offer to shelter residents. The city must eliminate administrative hurdles, robustly enforce source of income discrimination protections and other fair housing laws, and commit to building at least 6,000 apartments per year for homeless households and 6,000 apartments per year for extremely low-income households. Intros 132 and 513 could help homeless families, depending on how they are implemented, but they do not address the underlying problems with the onerous family shelter eligibility process that Councilmember Ressler laid out today. As previously mentioned, in July, less than a fifth of families with children who applied at PATH were found eligible for shelter, and only 10% of adult families were found eligible. We encourage the city and the state to address the many bureaucratic barriers that families face when they attempt to enter shelters, and to implement reforms that make it easier for both families with children and adult families to obtain appropriate shelter placements. Thank you.
Thank you.
Thank you, Jacqueline. Next is Amy Blumsack.
Hi, good afternoon, everyone. I'm Amy Blumsack, Director of Organizing and Policy at Neighbors Together. We are a community-based organization that is 40 years old, based in central Brooklyn, and we work with, I would say, over half of our members are homeless or unstably housed. So thank you, Chair Ayala and members of this committee for the opportunity to speak and for holding this hearing addressing homelessness. We are here today in particular to uplift our support of Intro 229. Last year's City FEPS increase was a really big step in the right direction, but there are significant barriers that remain to the voucher's effectiveness and efficiency. And some of the additions to the final rule that were implemented last year are causing a lot of confusion and really slowing down people's ability to move out of homelessness. In particular, in terms of Intro 229 and the utilities deduction, it effectively undermines the increase that we fought so hard for over all these last years. And, you know, in today's rental market, where from this year to last, rents have gone up over 20% in the city, it's a historic increase. To be undercutting the value of a voucher is short-sighted and problematic, to say the least, and effectively is keeping people homeless longer than necessary. Additionally, I think the utilities deduction is confusing. You know, many of our members didn't know that the utilities deduction was added to the City FEPS rule. They weren't aware of it. So we have definitely worked with members who, after overcoming the immense hurdle of source of income discrimination and actually finding an apartment that will take their voucher, right? Submitted their application, waited months for their application to be processed, and then only towards the end of those many months of waiting, thinking that they had an apartment available to them, found out that they weren't able to have the apartment because of the utilities deduction. So I think if the goal of the city and of HRA and DHS is to get people out of homelessness as fast as possible, then absolutely we need to pass Intro 229 and remove the utility deduction. We would also support creating a utility allowance, which would credit the amount of utilities to the tenant's portion, their portion of the rent. Oh, there was definitely one more thing that I wanted to say. Oh, right, that it is actually, it's important to remove the utility deduction and to give people choice, right? People who are homeless have to make the choices that are very best for their family, right? And so if we are removing the utility deduction, then they are able to choose, you know, do we want to pay all the way up to the top end? Like, do we want to use all the way up to the top end of our rental assistance voucher? That might get them access to an apartment that's closer to their network, closer to childcare, closer to family. We don't know, but we should trust people to make the decision that is best for their family and for themselves as individuals. And I guess the last thing I want to say is just to uplift that source of income discrimination is still a major issue. So while I understand the desire to make all vouchers sort of same and similar, they are all being discriminated against. And I think that anything that the city can do to address that is critically important. So I think removing the utility deduction, crediting utility allowance, and, you know, making that long-term investment in people, right, is essential. And then additionally addressing the rest of the barriers to City FEPS, which I'm going to lay out in our organizational testimony or written testimony are critically important as well. So thank you for the opportunity to speak.
Thank you, Amy. Next, Juan Diaz.
Thank you, Chair Ayala and members of the General Welfare Committee for holding today's important hearing. Good afternoon. My name is Juan Diaz, and I'm a Policy and Advocacy Associate at Citizens Committee for Children, a multi-issue children's advocacy organization dedicated to ensuring that every New York child is healthy, housed, educated, and safe. Today, I would like to focus my time on two bills. Intro 229 by Council Member Cavan will stop the deduction of utility allowance from the maximum monthly rent for city FEPs. This bill is important because it will ensure that the value of the rental assistance matches actual rental expenses and will prevent landlords and brokers from turning families away. Prior to joining CCC for over 3 years, I was a supervisor at Brownsville Home Base, a homeless prevention program funded by HRA. I witnessed firsthand how multiple administrative barriers with housing vouchers kept families from relocating in a timely manner and oftentimes led to shelter entry. Landlords and brokers demanded full rent and commission payments and expressed hesitance about utility payments. Families' confusions grew as they were unsure of their monthly rent contribution and who was responsible for paying the apartment utilities. The overall confusion of these unnecessary administrative barriers created several weeks of delays and eventual distrust between all parties involved. A utility allowance could make the process a lot easier for families to relocate. CCC is also supportive of Intro 522. Children in shelter are subject to substantial level of stress and trauma, and families urgently need mental health services. We strongly support this bill, but do want to note a few issues we feel should be addressed. Any bill enhancing services in shelter must include a funding mechanism at the appropriate level to attract and retain providers. To ensure providers are not being pulled out of communities in order to work within the shelters, we also feel the city should explore ways to provide flexible funding and partner with existing community organizations to bring providers on site at shelters. These providers could include existing Article 28 and Article 31 clinics, FQHCs, Health Plus hospitals, and other types of providers that offer unique models covered by Medicaid. Finally, the 1-to-50 ratio may prove unmanageable for professionals who are already facing caseloads and might be worth additional review. Thank you for the time and your commitment for children experiencing housing, and I plan to submit written testimony in the coming days. Just to conclude, as I mentioned before, I work at a home base in Brownsville for some time, some years, and I witnessed firsthand how many families in Brownsville struggle with these vouchers. And even after they move to other boroughs, they continue contacting home base with confusion over who's going to pay utilities, not being able to get assistance from HRA. So we truly want the City Council to focus on this bill. Thank you.
Thank you, Juan. Our next panel will be an in-person panel, and it will consist of Sarah Wilson, Milton Perez, Sharifa Harvey, Douglas Powell, James Lee.
One, two, 1, 2. Okay. Yeah.
We will begin with Sarah Wilson. When you're ready.
Thank you. Sorry. Okay. Good afternoon, everyone. Hi, my name is Sarah Wilson. For identification purposes, I am disabled and a former shelter resident. I spent 2.5 years in 5 different shelters, one of which was allegedly a medical facility, or MICA, which is a derogatory term they used to use. I emphasize this because this is my experience as someone entering the shelter system as dual diagnosed, both mental health and substance dependency. Not that it matters, but also in recovery as well, but somebody who came in already in services. I speak on this experience because as far as Intro 276, trauma-based training, it is imperative that that is beyond necessary in these shelters. Just a brief example, when it was time for my psych social, there was 10 different staff members sitting around eating lunch, like I was the entertainment, as I discussed every different trauma, therapy, provider, substance, all details of my entire history. I had to sit around and divulge in front of all these people who then I lived with. They giggling, different responses to all my different levels of trauma. And if I chose not to answer that, then they wouldn't have completed my paperwork. I was their entertainment, and this is just one very simple issue that is able to continue to go on because of one reason: people are not trained. So in addition to that training, other things that definitely would be necessary to prevent the trauma that people are now re-experiencing based on their stay in shelters. You know, there's no real reporting as well, which I've heard people mention around here today, which would definitely be an issue. And just to get on board with the omitting of the utility voucher, I definitely am in agreement with that as well. And I know that until we actually finally do away with the 90-day rule, and that's part of the city FEPS voucher as well, that's definitely holding up the length of stay, which I think I've heard people say it was over 1.5 years, but that'll take off a great deal of that length of time if when people are in their intake shelter and they can process their city FEPS application with those documents instead of waiting an additional 3 months. So I know I have a whole bunch of other things that I want to say, but I'll respect the time and yeah, in support of 276. Thank you very much and have a wonderful day, guys.
Thank you so much for sharing that.
Thank you, Sarah. Right on time. My name is Milton Perez. I'm from the Bronx, Puerto Rico. I'm a member of Vocal New York Homelessness Union. We have a preferred statement that's going to be submitted, but I don't feel like reading it right now. Some of the things in the title and in the statement are due to counterproductive rent reasonableness, unfair voucher deductions, opaque application process, and limited eligibility. I'd like to speak more on the perspective of somebody that was in the shelter system over 5 years. Let me put my glasses back on. The space that you guys are occupying right now, from the wall to the end of the desk, that's about the size of the dorm I was in, and I share that space with 20 people, 20 total. Where Mr. Eric is right now will be my bed in that space. There will be a locker where you're at, and there will be another bed where Ayala is sitting at right now, in that close of a space. So thinking back on those times, most of what's being said here is just talk. It's not good enough. Because if you're going to if you spend that much time in the shelter and you're lucky to get a voucher to find an apartment, and all of a sudden they pull the rug from under you and they bring these policies, you know, that, oh, the voucher, no, you're incorrect. Whatever policy they choose to pull up at that particular time, it's just not good enough, you know. So what Coban is doing to get rid of this particular barrier, you know, I'm all for it. Anything that the council is willing to do to get rid of some of these barriers, we're all for it as far as Vocal is concerned. There's too many barriers. This is just one of them. To your bill, Bill 92, the shelter where I was in, it was a 62-bed shelter. It was technically an employment shelter. but there were, at the height of it, there were 13 people in wheelchairs, 3 blind people, about 7 people with walkers, and people on dialysis, things of that nature. And I say that because they didn't receive any special treatment. You would think they would, but no, it didn't matter. They were in wheelchairs. They were elderly, 66, 75 years old. They were not treated in any special type of way. So your bill, I'm all for it also to shed some light on those issues with people with disabilities and how they're treated in the shelter system. Overall, this needs to be done. You know, the city council working with not only the city staff, but the shelter providers, and the most important people, the people that are directly impacted, whether they're advocates or presently in shelter or formerly in shelter. We all need to work together. Thank you.
Hi, my name is Douglas Powell. This is my ID. I live 111 Sunken Garden Loop. This is my disability card. Ms. Dana, everything you were saying was true. There is no accommodation for us. She sat here and she lied to you. I wanted to yell out and speak, but I didn't want to disrespect you, so I had to hold my patience. But she lied about the whole situation. I got there 2019, September the 4th. December 27th, the bed collapsed on me. They left me on the floor for 6 hours before they took me to the hospital because nobody walked. I was screaming, I was hollering, nobody came. I called people on the phone, but they was too far to come and help me. My family had to call up to the shelter. They hung up on them. They kept calling until somebody picked up and said hello, and they explained to them the situation, and then they came back there to get me. I stayed in the hospital for 6 months. They did not want me to come back to that shelter. The doctors, the social workers, they all fought for me to come back to that shelter. They discharged me out the shelter. They tried to make it like I was never in that shelter because they was trying to cover up that fall and them not walking around. So I don't know why she would sit here and lie to you like that, knowing she was lying. But she didn't know I was in the audience. And believe me, if I could have yelled out, I would have. But it would have been a totally disrespect. And I can't do that. I can't disrespect nobody. I was doing that when I was a kid. I'm a grown man now. So I gotta wait until the order. Now I have an apartment. I had it for 4 months. They supposed to call me. It's been 7 days since they called me. They've been holding this apartment for me for 4 months. They told me they can't hold it no more. I called the supervisor today. She said somebody was gonna call me. Nobody still never called me. Nobody from HRA still never called me. I went down there Friday and Wednesday. They said they was gonna call me. They still ain't called me. As far as the 229 bill, I'm with that. Because the thing about it, she just sat here and told y'all how we gonna spend our money. She ain't asking us. She told y'all we gonna give her $50 for light and $50 for gas. And I know I'm not using no gas. That's gonna cost me no $50, because I'm not cooking that much. So now you just took $100 from me for nothing. Now maybe the light, even though that's not gonna be 50, because I was always taught just to leave the bathroom light on, because of the way we was coming up. The bathroom light is gonna shine in the whole building, the whole apartment. So why would it cost me $50 for a light bill? So if they can help us not pay that light bill, that electricity bill, because somebody is getting over, because if I'm paying $19 in rent, and the bill is $2,218, where's that $318 going?
Time's expired.
With that, I gotta respect y'all again and go.
Thank you so much. And if I can help you, we'll talk.
Yes, ma'am.
Good afternoon. My name is Sharifa Harvey. I am currently experiencing sheltered homelessness and have been for over a year, over 2 years, over 3 years. So I want to speak to some of the general issues that are going on. with using city FEPs. But of course, there is the issue of having just being able to see an apartment once they know that you have a voucher. You don't get a call back. But I wanted to address the issue with the housing specialist as well, because some of the introductions are addressing having more housing specialists, which I think is necessary. I don't think it's appropriate. It's not enough to have three housing specialists in a shelter that has 100 people, 100 clients. That seems like it's set up to fail. And so they're supposed to be helping us to find housing. We're looking on our own, they're helping us. But if they are not doing their job, we languish, the clients languish. And one of the things I'll just give you an example of what happened yesterday. I get a notice telling me that I have a viewing yesterday. So I'm being told in the morning, so I'm supposed to go in the evening to a location and look at an apartment. Now, one of the issues I have is that that's not a timely notification, number one. It's disrespectful. And this is just what they regularly do. And number two, there should be what size unit it is and how much the unit is for. When I ask them these questions up front, they act like I'm asking them something that's like confidential. If it's a one-bedroom apartment and it's $900, that's very different than a studio that's $2,000. It doesn't, I mean, whatever the voucher covers, you need to be able to make an informed financial decision. And they're making it seem like, well, the HRAs pay for it. No, they're not. You're paying for it, you're paying for it later, even if you're not paying for it immediately now, all of it, you still have to come up with funds to get on your feet for later. So to act as if $2,000 is nothing because HRA is paying it, that's not how it is. Number two, you need to know what size unit it is. You need to have valid information. So it's more than just training, it's that it needs to be there needs to be policies and oversight in how housing specialists look for housing, where they're sending people. If I just got some interesting bit of information from hearing this hearing the council, and to know that they're sending me multiple times to an area that has the most people being evicted. That's interesting. And the places that they've been showing me when I've been able to actually see a unit have been going the landlords have been asking for over $2,000 or the maximum rent. Now that's ridiculous. That's just not making any sense. So these are the issues that need to be addressed. And I support all of the introductions, but it also needs to be oversight. And I think that the report should be more than just yearly, it should be monthly or quarterly.
I agree and thank you. Can you put your mic on? Jake,
press the button on the microphone.
Press the button, thanks. All right, well, my name is James Lee. Let's see, Intro 124 and Intro 229 are improvements, but more action must be taken to help people move out of shelters with vouchers. I've been in a DHS shelter since December of 2021. Administrative issues and payment delays must be addressed to restore landlord and broker faith in the voucher system. Even those that don't discriminate based on race or income won't accept vouchers if they don't think they'll be paid. When voucher holders are disadvantaged compared to other applicants, landlords and brokers find ways to not rent to voucher holders, especially when there are other applicants for an apartment. So voucher holders are left stuck in the shelter system unless they agree to move into the worst neighborhoods, straining the shelter system, increasing costs, and effectively resulting in income discrimination. While these bills address the lack of housing specialists and the utility allowance, the city should make additional improvements to city FEPs to address these administrative issues. Just going to address a couple of other things that were said earlier. The shelter that I'm in didn't have a housing specialist since December. And I understand the lady up here, she said they've had housing specialists. And maybe she's just misinformed, or maybe someone's not telling her really what's going on. Because I notice going through the system, there's a lot of that happening. Someone tells you something to your face, and they're completely wrong. And sometimes you don't get the impression that they're trying to lie, but they're really wrong. They really are. Let's see. another thing is, do any of you know how much it costs to put someone in an individual adult shelter for 1 month? Is it $4,000 or something like that? Okay, right. Okay, so yeah, I'm gonna like bring that up like in my written testimony, which I'll submit separately. Final question. For the Committee on the General Welfare, like, is there a way to get in touch with you guys? Like, I just like look on the website or do that? No?
Yeah, we can get you the information.
Okay, yeah, it's like, should I leave it with the man-at-arms? Because I have to leave right after this.
Okay.
So.
You can also submit something to me and I can forward it to the staff and they'll call you.
Sorry, submit it to her?
To myself.
To yourself? Oh,
Yeah,
okay,
yeah.
I'll do that.
My information is online.
Oh.
Thank you.
Thank you so much.
Thank you. Any questions for this panel? No. Thank you all so much for coming in and sharing, and don't leave, I want to get your information. Great job, guys.
Notice you made it within 3 minutes. The homeless are always doing their job, always following the rules. Thank you.
I will now call our next panel, which is a virtual panel, and it will consist of Alexandra Doherty, Patrick Boyle, Kanisha Atkinson. Alexandra, you may begin when you're ready.
Hi, good afternoon. My name is Alex Doherty. I'm a senior staff attorney and policy counsel at the Civil Justice Practice at Brooklyn Defender Services. I'd like to thank the committee and Chairwoman Ayala for inviting us to testify. BDS supports the goal of all of today's bills of addressing barriers, preventing New Yorkers from accessing shelter, and ultimately securing stable housing. First, we strongly support establishing borough-based family intake centers. Families experiencing homelessness are routinely shut out of the family shelter system because PATH remains the single point of entry. The intake process has become increasingly opaque and backlogged in recent months. The people we serve, many of whom, it's been mentioned, travel for over an hour from all over Brooklyn to the Bronx, have reported waiting a PATH all night with their kids before receiving temporary placement. Establishing additional intake centers is a necessary first step, and DHS should further improve shelter accessibility by easing the many other onerous eligibility criteria that have been discussed today. BDS also strongly supports Intro 229. The convoluted utility rules add unnecessary difficulty for New Yorkers who are already struggling to obtain and utilize housing vouchers. We repeatedly see clients find apartments below their voucher rent limit, only to learn later that the apartment won't be approved because not all utilities are included in the rent. For example, one BDS client, Ms. O, was recently selected for a 2-bedroom apartment after 2 years of apartment hunting with a voucher. The unit was $200 under the city FEP's payment standard, but the utilities weren't included. So after the deduction, the unit didn't meet the payment standard. Ms. O was then put in the position of accepting a 1-bedroom, which was too small for her and her kids, or starting her whole apartment search from scratch with a looming eviction date. Removing the utility deduction would simplify the city FEP's application and apartment approval process for everyone involved. And finally, we appreciate the intention of Intro 522, and we agree that entering into a family shelter is a stressful experience. But we're concerned that introducing mental health professionals who are mandated reporters directly into family shelters, which are people's homes, will inadvertently increase surveillance of low-income families. In our experience, Black and Latinx families are already vulnerable to unnecessary reporting to child protective authorities because of biased reporting that conflates poverty with neglect. The near constant surveillance in family shelters puts these families at increased risk of reporting, and placing mental health professionals, who are mandated reporters, within this setting only amplifies the risk. We ask that City Council consider providing mental health services that are community-based, culturally competent, flexible, and importantly, funded outside of DHS and ACS. Thank you again, and I'll direct you to our written testimony for additional comments. Thanks.
Thank you, Alex. Next, Patrick Boyle.
Thank you so much to the chair and to the members of the committee for the opportunity to testify today. My name is Patrick Boyle. I'm an assistant vice president of public policy with Volunteers of America. We're a social services organization working to end homelessness in the greater New York area by 2050. We're also a nonprofit developer of affordable and supportive housing, as well as a homeless services organization. Our full testimony will speak to our comments on the full range of bills being heard today. But in my limited time, I just wanted to point to a few reactions we had to a number of them. The first one I'd like to point to is Intro 0108, that's tracking social service providers like VOA and others across a number of different metrics. VOA, we're very open to all scrutiny of nonprofit providers. We feel like it's a very important part of the process. However, we're concerned with some elements of this legislation and some of the metrics being tracked lacking necessary context and nuance, as a few of the previous speakers have spoken to. We don't want to create a system where there's misinterpretation of this data and metrics in a way that unfairly leads to scrutiny on providers like ours based on program types, program sizes, and other such metrics. We also wanted to comment today on 0190, the Homeless Bill of Rights. This is a concept that we're very supportive of. We're also an organization that is very committed to ensuring all clients that come through our programs here in the city understand their full range of rights, their ability to file complaints, to seek information across a whole range of services. However, we just want to ensure that this legislation is merely capturing rights and regulations that already exist and isn't creating anything new and isn't in conflict with anything that we're required to do as providers. So I think there's some further analysis needed of this to ensure that there's nothing that's conflicting with our existing obligations as providers. Another bill I want to address today is 0132. Which is the legislation to encourage and take shelters in all boroughs. So as many previous organizations that we work with have commented on, we're very supportive of this legislation. We feel it would greatly reduce the burden of individuals and travel times and other hardships related to seeking their legal right to shelter. And so we really encourage the council and the administration to take this up and to really kind of push back against some of the obvious political complications that arise from citing. We're very encouraged by the council members who said that they would encourage this within their own council districts. I think that's more of the leadership that we need. So again, I just want to thank the chair, thank the other members of the committee for the opportunity to host this hearing and for hosting a hearing that's really focused on the shelter world and the shelter experience, particularly for clients, which is really important to us as an organization. So thank you.
Thank you, Patrick. Next, Kanisha Atkinson.
Hello, can you guys hear me? Hi. Thank you for this opportunity to speak here. My name is Kanisha Atkinson. Thank you for the opportunity to speak on behalf of myself and the New York shelter residents. I was taught from I was a young child that closed mouths do not get fed. If you want change, sometimes you have to be the voice of reason. As a young individual living with disabilities in the shelter, I stand by Intro 92 to create an accessibility advisory board. This bill will be important because the voiceless with disabilities will finally be heard. The tears that no one knows about won't be in vain, and the trauma from being dismissed, overlooked, and muted can slowly start to heal. This is for people who came before me, the ones that stand with me in the present, and the ones who will come after. With that being said, I have been in the system now for about 3 years, going on 3 years. And one of the main things I always told myself was, I was not going to leave the system without my voice being heard about some of the things that go on that shouldn't go on, especially when you have disabilities. And I want this bill to be passed because I see people that could be my mom and my grandmother that are here that they don't even have the right help. They're not getting the proper medical attention, and they're just stuck. And I don't like seeing that, especially as a minority, because unfortunately, my skin tone is the tone that I see more than anything else in the system. And I told myself, even before I leave, I want my voice to be heard, and it's happening. Thank you.
Sorry, thank you so much for that. And you know, I believe that it is important that people like you and I and others with shared experiences, you know, are vocal, because you're right. You know, if we don't speak up, no one will, and change will not, you know, won't happen. So thank you.
Thank you. I will now call up our next panel, which will consist of Sarah Newman, Jonathan Gaffney, and I apologize if I mispronounce your name, Minbiyu Ashagre. We'll begin with Sarah Newman.
Sure. Thank you to Chair Ayala and to the General Welfare Committee for the opportunity to testify today. My name is Sarah Newman, and I'm the Director of Organizing for the Open Hearts Initiative. OHI supports communities across New York City who welcome homeless neighbors and advocate for housing justice in our own backyards. And through this work, we've gotten to know hundreds of neighbors who are experiencing homelessness, some of whom are here testifying today. And we're here today to advocate alongside them for reforms that would help address some of the key issues that they experience in the shelter system. There are two themes that come up again and again in our conversations with homeless neighbors. First, that it's far too difficult to exit shelter and get into permanent housing. And second, that in their time in shelter, they often feel dehumanized rather than supported. Right now, as many folks today have testified, so many people are staying in shelter for years, not because they want to, not because they don't have a voucher, but because it's so hard to get into housing. And if we want shelters to be a brief stop on the way to housing, we need to make it easier for people to exit shelter and get housed. And we should be staffing shelters with that goal in mind. Having dedicated housing specialists is an important step to do that, and we strongly support Intro 124 for that reason. I also want to echo what folks have said, that despite what DHS said today, what we hear from folks is that there are not dedicated housing specialists in every shelter, that caseworkers are often playing that role. And no matter how great a caseworker is, when they have a large caseload and are managing a wide range of responsibilities, it's really hard to be proactive in the way that you need to help someone navigate a really challenging housing search. So we hope that this would be a full-time position rather than something loaded onto caseworkers' already full plates, and hope that will be made explicit in the legislation. Another immediate step that the council can take to help folks exit shelter more easily is passing Intro 229 to remove the utility deduction. As folks have said, this currently acts as yet another barrier to finding housing by decreasing the value of a voucher when utilities aren't included in the rent. And so that's very important as well. And finally, it's also important to make sure that for whatever amount of time folks are in shelter, they're being treated with respect and dignity. And that's unfortunately something that our homeless neighbors tell us sometimes is not happening in the shelters that they're in. Staff behavior plays a really big role in creating a safe or unsafe environment in a shelter, which is why Intro 276 is really important. Shelter staff need to be given the tools to handle the moments of conflict that will inevitably come up in a setting where people are experiencing immense stress. De-escalation training and trauma-informed care are crucial, and that work should go beyond an annual training, as many folks have mentioned, but that training is a good first step. Thank you.
Thank you, Sarah. Next, Jonathan Gaffney.
Yeah, hi, my name is Jonathan Gaffney. I'm the Housing Campaign Manager here with Neighbors Together. You already heard Amy Bloomsack speak. And I'm going to read the words and testimony from one of our formerly homeless members when describing this hearing and the legislation that it would entail. This woman was adamant that I share some words on her behalf. She was extremely excited about the prospect of giving verbal testimony. When something came up last minute, she told me to read some words on her behalf. So thank you so much for your time. And yeah, one of our members' names here is Shaniqua Bryan. She was a formerly homeless member leader at Neighbors Together. She has had a City FEPS voucher for over a year. And here's her statement. In conjunction with raising my rent, my landlord refused both Link and City FEPS as payment methods when Link was still around. After fighting to stay in my apartment and working with city agencies like Homebase, I became homeless a couple of days before Thanksgiving with my 2 teenage children. Thankfully, I'm currently in an apartment that suits my needs. However, that is primarily due to the help of Neighbors Together. Neighbors Together worked with the press to shine a light on my circumstance, which helped me tremendously. Working as a teacher's aide for the city of New York, people were baffled that a person like me, who was gainfully employed, could become homeless. I do not believe that I could have found an apartment that suited my needs on my own, in large part due to the utilities deduction. While in the shelter system, it took me over 8 months to find an apartment with my City FEPS voucher. I believe that the utility deduction was a huge reason why it took me so long to find an apartment. It limited what apartments were available to me. The utility deduction being a massive hurdle is not an isolated issue with just myself. When I was in the shelter system, I heard so many other people having the same problems with the utility deduction, reducing the overall price of the voucher, making it less effective. I hope that the utility deduction is removed entirely from the City FEPS voucher and a more reasonable utility allowance or something different can be implemented in instead. Again, those are the words of Shaniqua O'Brien, a formerly homeless member leader at Neighbors Together who could not be here, so I'm testifying on her behalf. Thank you so much for your time, and I would like to yield time back to the committee.
Thank you, Jonathan. Next, Minbiyu Ashagre.
All right, I can be heard. I don't know if y'all can hear me,
We can hear you.
Okay, great. So I would first like to start by saying you pronounced my name pretty well. Surprised me. I wrote something, so I'm trying to get to what I wrote. So if you guys can bear with me a second. All right. Hi, everyone, and thank you for this opportunity. I am a paraplegic who's fully paralyzed from the chest down. I tell you this just so you know where I'm coming from when I speak. I have been in a city shelter for a while, and there have been many times when I felt no one cared or understood what I was going through. We need special attention, for we all do not have the same disability. Intro 92 bill would be a great step forward, in my opinion. Shelters have a lot on their hands, and sometimes things can be overlooked. When things are overlooked, people suffer. An extra pair of eyes would not be harmful to anybody. Being homeless is difficult in itself, but I can tell you from experience, being homeless and disabled can be hell. There is so much to accessibility than just having a ramp. This is part of the reason why I love the fact people with disabilities who are or have been homeless can bring up ideas and suggestions. Talking with other people who are disabled in the system, I can say we feel discouraged, left out, and we feel as if at times we are on our own. Things do not just get better on their own. Questions have to be asked and answered, and work has to be done. This is why I believe in Intro 92 bill. I would like to close by saying this can only do good rather than harm. I truly hope it's passed. Thank you.
Thank you. We will now call our next panel, which is also a virtual panel. It will consist of Nora McCarthy, Helen Strom, and Katrina Corbell. Nora McCarthy is first.
Hi, everybody. Thank you so much for the invitation to testify today, members of the committee and the public who I really enjoy hearing from. I'm the director and co-founder of the New York City Family Policy Project. For 25 years, I've been working with youth and parents impacted by the child welfare system here in New York City, as well as families impacted by homelessness. It's from this position that I'm speaking today about some of the unintended effects that some of the policies introduced today may have on children and families in New York. I'm also speaking with you on behalf of partners who joined with Family Policy Project on testimony, Safety Net Project, the Center for Family Representation, and RISE, which all work with families impacted by homelessness as well as child welfare involvement. I wanted to share our support for Intro 276 that would bring a trauma-informed lens to DHS shelters. As many people have said, this is badly needed. Treatment of families in shelters is often deeply discouraging and ugly, and training to offer a more supportive and caring environment is very much needed. At the same time, we oppose Intro 522 that would mandate mental health providers in shelters. As some other folks have mentioned, this raises real privacy concerns and is likely to increase the shelter to ACS pipeline, which harms families. It can function as a form of surveillance that can actually discourage families from seeking treatment and from getting the help that they may want. And it also conflates involvement in shelter with a mental health issue in ways that is troubling. I really truly hear that the council's intent in mandated mental health services come from a place of wanting to make sure that families can get support. That family support can be much better provided by investing in our community providers, making sure that there's continuity of care for families to continue getting help once they leave shelter, and not concentrating our mental health resources in places that are meant to be temporary and also non-stigmatizing. From much of the discussion and testimony today, you would think that PTSD and mental health issues are the main driver of shelter involvement. I think everybody here knows that we have a terrible housing crunch. Landlords are not accepting vouchers, rent is through the roof, and our resources really need to be directed toward housing, and our shelter staff need to be primarily involved in focusing on long-term permanent housing. There was also some disturbing talk in the Daily News about this bill, saying that mental health providers in community settings cannot assess family dynamics. Families facing a housing crisis do not necessarily have family dynamics that need to be assessed. They're also in a time of emotional crisis. That's not really a prime time.
Time's expired.
About kids and families. That's a time just to provide supportive care. So again, we really support having trauma-informed care, but not conflating mental health care and shelter stays in ways that are inappropriate and stigmatizing to families.
Thank you, Nora. Helen Strom.
Hi, good afternoon, and thank you for the opportunity to testify. My name is Helen Strom, and I'm the Benefits and Homeless Advocacy Director at the Safety Net Project at Urban Justice. Thank you, Chair Ayala and members of the committee. I want to briefly speak on a few bills today. First, we offer our strong support for Intro 229 regarding city PEP's utility allowances. While the administration mentioned a choice between helping tenants with utilities and reducing maximum voucher rates, we believe that this is a false choice and the city can do both. They need to increase the voucher rates. We also strongly support Intro 276, which would mandate that all staff receive de-escalation and trauma-informed theory and cultural sensitivity. This is badly needed. Finally, we want to speak about Intro 522. We acknowledge there's a real shortage of access to mental health care across the city, including for families. However, we have a lot of serious concerns about some of the possible consequences of placing mental health professionals on site at all families with children shelters. We think a better option for the city is to fund dedicated lines for additional mental health support off-site within city healthcare systems and to prioritize homeless New Yorkers for these appointments. We believe that this would provide access that's needed while eliminating the risks we'll go through below. First, we're very concerned about privacy. Generally, treatment and therapy relationships intentionally happen in a space outside of the home to emphasize consent and control for people who seek treatment. When we've discussed with our members who are in shelter or formerly in shelter, they're very concerned about the idea of having their providers within the place where they're living. Additionally, we're concerned about the potential for this to be used in a punitive way. The state regulations provide broad discretion for DHS and for family providers to place things like mental health care within people's independent living plans or ILPs, and to even discharge families for failure to comply. Unfortunately, this is something we see with many providers and within the DHS system, and we believe that this provides other opportunities for that as well. Finally, we think this could set up more fragmented care than we could get if we connect people to care within the communities. For people to start a treatment relationship and then lose that treatment relationship as soon as they access shelter is not good for the long-term mental health or treatment of that person. We think connecting people within healthcare systems in community with dedicated access is a much better solution to have continuous long-term care. And additionally, we're concerned that future administrations and some providers could use this in a way to surveil homeless families. Unfortunately, there's already a strong shelter to ACS pipeline, which we know about and which we're concerned this bill could worsen. And we've seen with many providers a tendency to pathologize and say that the cause of families' issues is mental illness, when we know that the primary drivers of family homelessness are eviction, unsafe housing conditions, overcrowding, domestic violence, not mental health. We firmly believe families need access to voluntary care. However, we believe that the option that gives them the autonomy, the choice, the privacy that they deserve can be achieved by funding additional dedicated care in the community where they're not subject to potential punishment or policing by shelter staff or providers. I really welcome any questions or an opportunity to discuss any of these concerns, because we definitely agree that access to care and mental health care is a big need in this city, and that it's one where people are facing enormous waits and really a lot of difficulties in access. But we just think there's a lot of risks with this model in particular, and would really love to discuss with any members of the committee or staff.
Thank you, Helen. Katrina Corbo.
Hello, my name is Katrina Corbell, and although I am with numerous organizations, today I am testifying as a person with lived experience, as somebody who has been in a single adult shelter, and also with some friends who are at, who have had experience with the PATH shelters. I mean, as we know from the testimony that was provided by the Department of Homeless Services and DSS, it's not as clean cut as they seem to present. One of my friends is currently at a PATH, or at a PATH shelter, family shelter, and still has to go to PATH every 10 days to check in. It's not something they can do by phone or by, telecommunications. So that, just wanted to point that out. In regards to Intro 92, I do hope that this remains independent, that it does not end up becoming, biased towards the shelter, but that the shelter residents or shelter clients are able to be represented, that it's not going to just be cherry-picked ideal clients that are nominated to, submit testimony or submit beyond roles in that proposed council. In regards to Intro 108, I wanted to just make sure that it's going to be all of the providers and not just the 2 or 3 DHS locations. A few years ago, DHS tried to provide answers in regard, letting council think that they were answering for all of the shelters when they were really only answering for their own personal shelters. In regards to the housing specialists in Intro 124, I would hopefully encourage people to just hire people that are, passionate about their job and actually want to do this, want to go into social work, and not hire the people that have no interest and are just looking for a job. Hire people that are actually dedicated to their job and want to stay in that role, stay in that position, stay in that industry. And that way people that are in shelters trying to get into housing don't have to keep waiting 3 months or 6 months for another housing specialist to be hired and be trained, while they're trying to get into housing appointments or housing interviews. For 276, I totally support. I am hoping that, all shelters are included, not just the DHS, 2 or 3 shelters.
Time's expired.
Okay, thank you.
Thank you. Our next panel will be in person, and it will consist of Tawaki Komatsu, Kimberly Blair, and Scott Hutchins.
You may begin whenever you're ready.
Hi, I'm Tawaki Komatsu. Ms. Ayala, I've testified to you in previous public hearings. Before she left City Hall today, I talked to Molly Park as she left the room. She basically lied to your team today. She basically talked about training. Also, there was a representative from Urban Pathways at the end of the desk over here. That representative for Urban Pathways didn't tell you about the fact that if you look at ProPublica's website, it shows that Urban Pathways spends 45% of its operating expenses on compensation for its personnel. So meaning if you give them $10, they pocket $4.50. So the question is that $5.50 sufficient to the clients or whatever? The point is, HRA just issued Urban Pathways like a $38 million contract. I currently have litigation against Urban Pathways. It's committing fraud in that litigation. I've talked to you previously about Urban Pathways. So in terms of oversight, this committee, General Welfare Committee, you as a chairwoman, you're supposed to provide oversight of how HRA operates. I previously visited DOI after that Julia Saville thing broke. And basically, DOI, what they had to say to me was, you know what, we're going to refer your complaint back to HRA. So the point is, if you take the case of like a rape victim, if you report a rape to a police officer, just imagine if the police officer told you, you know what, you have to work that out with your rapist. Do you understand my point here? If you have a complaint against some person, some entity, why is DOI telling me, you know what, we're just going to shove that complaint back to the entity that your complaint is against? So with regards to training too, when Ms. Park was, I guess, sitting around here, I had litigation against HRA since 2017, and an attorney for HRA, Jeffrey Mossick, he put my social security number in a public court filing. So with regards to the issue of privacy, the woman from HRA was here today talking about privacy. Do you know what can be done if your social security number is publicly disclosed, if your date of birth is publicly disclosed? I apprised HRA's general counsel of the fact, you know what, I saw this information in a public legal filing. Court procedures mean it has to be redacted. I told HRA's senior attorneys, you know what, you screwed up, you need to fix this. Guess what? They ignored me. So with regards to Ms. Park's point about training, also, there's an upcoming public hearing on September 22nd about another proposed contract with Urban Pathways. Do you want to come with me to HRA's headquarters? We can walk through the door together. I'll buy you a cup of coffee, just to make sure that I can walk through the doors, look at that contract, and when there's a public hearing about the contract, I can testify knowledgeably about the contract. I told you previously, I believe, HRA will not allow me into its headquarters to see that contract, irrespective of what my First Amendment and 14th Amendment rights are. So can you do something about it as a chairwoman of the committee?
I would suggest that you foil the request.
They ignore it. Also, last point really is this. I have a subpoena that I can have issued against HRA. So instead of you giving me information, is there anything that you want to know about HRA that I can provide to you through the subpoena? Any of you?
Not at this moment, thank you.
Thanks.
You may begin.
Good afternoon, Chair Ayala and members of the committee who were here, but it's a long day. Thank you for holding this space. My name is Kimberly Blair, and I'm the Director of Public Policy and Advocacy for the National Alliance on Mental Illness of New York City, or NAMI NYC. I also identify as someone who lives with mental health conditions, and who has benefited from life-saving psychotherapy, such as that proposed in Intro 522, which I urge you to support today. First, it is important that I orient you as to what my organization does. For 40 years, we have been a leading service organization to the mental health community. And in addition to our free support groups and classes, we also run a confidential helpline that connects peers and family members with referrals to mental health services and more. Most calls are received in the aftermath of great crisis, such as hospitalization or losing housing, benefits, and employment due to a mental health episode. People struggling through these crises often come to us because they have great difficulty navigating the confusing terrain of mental health providers and insurance restrictions on their own. These hurdles delay critical care and delay family members ultimately reaching the recovery that is responsible for keeping family units together and ending the cycle of trauma. Now, imagine going through these hurdles while also navigating homelessness, which in essence is a traumatic experience itself. This is what 12,124 families in New York City shelters have faced since 2019, because the social workers introduced by the city in 2016 to the shelter system have not been able to exercise the full range of their qualifications and provide essential psychotherapy in-house due to lack of financial resources and personnel. Meanwhile, the data from the Office of Community Mental Health demonstrates that 66.7% of families in shelters have been screened for behavioral health needs, yet only 0.4% of families have been able to attend an appointment from January to March of this year, and only 2.3% of families from April to June of this year. While we need more analysis to understand why families receiving referrals are not actually getting care, we can deduce that there are barriers we all experience with mental health conditions, right? Stigma, long wait times, and lack of financial resources. To reiterate, 66.7% of families, i.e. the majority of families in shelters, need life-saving treatment, and the city's current response is to provide 0% of that treatment at the most critical point in the timeline of adverse life events a family may face, homelessness. Our organization sees this as unacceptable and as a moral failing on behalf of our cities to families in crisis. However, with a small investment to Intro 522, we can remediate this failing by ensuring that family units dealing with unaddressed mental health conditions and homelessness receive the care that they need and get connected to long-term care providers. And I will submit the rest in written, but I also want to stress that there is a gap in the continuity of care, right, currently. For all of us, I've waited during the pandemic many months to see a provider. Imagine being homeless and your one priority really should be getting your family housed. You should not be having to deal with trying to juggle that. So by starting in the shelter and then making sure that you have that gap filled until they can meet with community-based providers, we can really make this work.
Thank you.
My name is Scott Hutchins, and I'm here representing Vocal and Neighbors Together. I've been actually in an apartment with my City of Phipps voucher. I'm starting my third year, and just went through the renewal process and an increased rent. First, I wanted to talk about Intro 229 with utility allowance. My utilities are actually paid through an additional voucher. got Craig Hughes from Urban Justice Center helped me get my apartment, and this whole system is not going to work if everybody needs to get help from Urban Justice Center to get an apartment. First, I wanted to say in regard to Intro 229, the difference between rent plus utilities is trivial between the difference between the total cost to put someone in an apartment and compared to putting someone in shelter, because as we heard, it was $4,000 a month approximately to put someone in shelter. The first shelter I was put in after 30th Street was Eddie Harris in 2012, and I saw how poorly they were delivering their services to us. And in 2019, the CEO of the Bushwick Economic Development Corporation that runs Eddie Harris Shelter was busted for embezzlement. He was taking a salary of over $600,000, and their sole funder was the city. I was in the shelter system for 99 months, 8 years and 3 months. Mainly because I have physical challenges and I couldn't get disability. they kept sending me to get disability, and the Social Security Administration kept saying, you can do a desk job, you're not disabled by our standards. And because I wasn't able to get a desk job, because I was trying to get interviewed, the shelter, the last shelter I was in, and this is why Craig Hughes intervened, gave me this mental health evaluation. He sent me an email that DHS had actually canceled. The guy threatened me, he's gonna threaten me with arrest if I didn't come down there. And he and my caseworker listened as this person on the payroll did a mental health evaluation from me because they were trying to get me into supportive housing that they run where I'd be forced to be doped up. And that was my 9th shelter, and every shelter I went to, they had me do a mental health evaluation. Mostly it was independently. 80 3rd Street had an in-house registered psychiatric nurse. None of them found anything that would get me disability. It was just like stress and nothing more than that. And also these housing specialists, a lot of times they don't know what they're doing. The housing specialist at Eddie Harris in 2012, first she took me to a place when I didn't have any income at this point. And that's one of the big challenges, not being able to get any income because I wasn't getting interviewed, and acted like that was a mental health issue, even though it wasn't like I was going to interviews and messing up. I just wasn't being contacted, and I was showing them the spreadsheets. I applied to 3,895 jobs while I was homeless. I just want to say the housing specialist there took me to a shady broker that wanted money up front before they even showed me anything. And she also tried to get me in a 3-quarter house, and that the housing specialist at most of the shelters would give me threats if I didn't look for housing, and I didn't see a point of looking for housing if I wasn't employed, because the voucher was only good for me if I was employed, which is why we need the HAVP at the state level. Thank you.
Thank you. We have now heard from everyone who has signed up to testify. If we inadvertently missed anyone who would like to testify in person, please visit the sergeant's table and complete a witness slip now. If we inadvertently missed anyone who would like to testify virtually, please use the raise hand function in Zoom, and I will call on you in the order of hands raised. Seeing no one else, I would like to note that written testimony, which will be reviewed in full by committee staff, may be submitted to the record up to 72 hours after the close of this hearing by emailing it to testimony@council.nyc.gov. Deputy Speaker Ayala, we have concluded public testimony for this hearing.
I just want to say thank you to all of you who've come to testify and stayed. This is obviously a very important subject matter, and I'm happy to be able to count on so many of you as partners in government. So thank you all, and with that, this hearing is adjourned.